Go ahead, Mayor.
Thank you very much, Madam Clerk. I want to call to order this extraordinary meeting of the Joint City-County Committee. We are joined today. We've invited all of our council members and commissioners, and we've also invited the members of our school board, and we're excited for our members of our school board to be with us today. We thought it would be a good time because we're reviewing a lot of different aspects of our community's COVID-19 response, to have our school board members with us, and it's good to see you all, faces on the screen. Glad to have you. This committee actually does have certain set members who vote. The only vote that I'm anticipating today will be on the approval of the minutes, and Madam Clerk is going to help me with that. You all know that with the online meetings that there have to be some certain protocols to make sure that those who vote actually are raising their hand or are voting, and so that can be recorded. But that's the only vote I anticipate. And when that happens, voting members will figure that out as we go. This is a public meeting. We have members of the press here. We're glad to have them, and members of the public and are also listening in. So thank you to everyone for your interest. The agenda is about a 2.5-hour agenda. I'm going to try to adhere to it pretty tightly. I know that 2.5 hours in front of a Zoom camera is pretty daunting. And so if you have to take a break, you won't hurt anyone's feelings. But we have, I think, an excellent agenda. And I want to express my appreciation to our city clerk for coordinating all this, to the county clerk for helping out, and to the staff of our school board, our public schools, our city, and our county. We have a lot of different presentations, and everyone has worked very hard to make this work, and I'm grateful. Since there are, I believe, 18 different members of the various elected bodies who may have questions and comments today, here's my plan. Wendy and I take turns chairing this meeting. This is my turn. She'll chair next time. So my plan is that I will ask, I've put by each agenda item who I think might begin the questioning. I tried to make this sensible so that people, for example, on the school board might not go first in asking questions on school issues because you've probably heard about them previously. So I'll do my best to try to make that happen, so that everybody can get plenty of questions in. But I do want to say that we have, like I say, about 18 elected officials, and we can't all ask questions on every item or make comments. So we'll do the best we can and try to adhere to this 2.5-hour time frame. So again, I want to welcome everyone. Thrilled to have our school board members here with us. I had some good years on that school board, and remember all the hard and good and important work you all are doing, so thank you. I'm now going to move to the approval of the draft joint city-county meeting minutes of January 14th, 2020 and March 10th, 2020. Both sets were sent to us. First of all, I'll ask, are there any additions or corrections to the minutes? And for those who, if you are a member of the committee and you want to make additions and corrections, at this point, simply speak up. All right, hearing none, I'll say one correction, Madam Clerk, is Reginald Johnson's name was spelled wrong at least once, so I'll ask for that correction. But otherwise, I have none. And I'll ask now for a motion by one of the members of the committee to approve the minutes. My roster of the minutes is myself, Mayor Pro Tem Johnson, Councilmember Freeman, Commissioners Jacobs, Hill, and Reckow. I believe those are the actual members of the committee plus alternates. So can I have a motion from one of those people to approve the minutes?
So moved.
Been moved, and is there a second?
Second.
Thank you. I believe that was moved by Commissioner Jacobs and seconded by Commissioner Hill, if I got that right. All in favor of that who are voting members, I'm going to call your names, and please please say aye or nay. Mayor Pro Tem Johnson,
Aye.
Councilmember Freeman, I'll move to Commissioner Jacobs,
Aye.
Commissioner Hill,
Aye.
Commissioner Reckow.
This is Monica Toomer, County Clerk. Commissioner Redcow is having a little difficulty logging in right now, but
Okay,
she said that she had a few corrections for the minutes.
okay, thank you, Monica. I think then what we will do, Councilmember Freeman, would you like to vote? If you're having technical difficulties, you can give me a thumbs up. All right, I think what we'll do now, Monica, thank you for that information. We'll wait for, we'll ask Commissioner Reckow to give her her comments when she comes, but I believe a majority of the members have approved the minutes. Okay. And now we'll move to the second item on our agenda, which is the update on the Durham City County current COVID-19 situation by Rod Jenkins, our health director. Rod, are you with us?
Mayor Schewel, can you hear me?
Yes, I can, Rod. I can't see you, but I can hear you.
Okay, can you see me now, sir?
Yes, and Rod, before you get started, I just want to express our gratitude to you. We've all been on some hot spots, but nobody's been on a hotter spot than you have these last 3 months. And I just want to appreciate you. For those of you all who don't know, I think we all do know that Rod arrived at a very interesting time in the history of Durham's public health, and has stepped right into the breach and done so with incredible energy and commitment to the job, Rod. So thank you so much for what you've done. And we're all really grateful to you and looking forward to hearing your report this morning. And I'll just say that the order of questioning after reports will be council members on this item, commissioners, and then school board members. So go ahead, Rod.
Appreciate the kind words, Mayor Schewel, and again to Chair Jacobs, Vice Chair Hill, and members of the Board of County Commissioners, Mayor Schewel, Mayor Pro Tem Johnson, and members of the council. Allow me to sincerely thank you all for your support of public health, not just during regular times, but especially during this pandemic crisis. We cannot overexpress your support, your questions, your inquiries. You've shown that you take your elected position seriously by the amount of care and commitment to ensuring that the citizens are taken care of. So we certainly appreciate that. Just want you all to know that you're appreciated, and to really express that Durham is in a great position because of the actions that you've taken. So just give you some numbers as of right now. As of 8 o'clock this morning, globally, we're sitting at 4,058,252 cases of COVID worldwide, resulting in 281 deaths. 281,736 deaths, and that's in 213 countries, areas, or territories. Within the United States, there are 1,324,488 cases of COVID, resulting in 79,756 deaths. And that's in all 50 states and 5 U.S. territories and jurisdictions. In North Carolina, there are 45 cases of COVID throughout the great state of North Carolina, resulting in 550 deaths, and that's in 99 counties. And here in Durham, we're sitting at 897 cases of COVID, resulting in 35 deaths. The average age of our COVID-19 cases is around the age of 48. An age breakdown under the age of 18 represents about 2% of our cases. Ages 18 to 44 years of age represents 44% of our cases. Ages 45 to 64 represents 34%, and 20% of our cases are over the age of 65. A little more information about our overall cases. 44% of our cases are female, 56% of our cases are male. 15% of all of our cases are healthcare workers or work in a healthcare facility. 13% of our cases are associated with travel. 70% of our cases are what we call close contacts of a confirmed case, and they are now have tested positive. I'm happy to report that 17% of our total cases are what we consider to be community spread, meaning there's been no travel history or no known close contact. Of that 17%, approximately 20% of the community spread does have something to do with healthcare workers or they work in a healthcare facility. 1% of our cases are still under investigation. We have relatively few hospitalizations. Right now, we have approximately 26 cases that are currently hospitalized, and about 451 cases have been released upon DHHS's guidance. So that means that they have truly been recovered. And then we have quite a few that are still isolated and being monitored by public health. And by monitor, I mean they receive a phone call every day just to make sure that everything is okay. Outbreaks are defined by the CDC as 2 or more lab-confirmed positive cases of COVID in a congregate setting. And here in Durham, we're not like any other jurisdiction. We do have our struggles with congregate settings outbreaks. Within this demographic, 49% of our total cases are associated with 1 or more outbreaks. Of those outbreaks, 70% are close contacts. Again, 17% is community spread, 12% is related to travel, and then we still have 1% that's under investigation. Total cases of healthcare workers who have something to do with an outbreak is around 14%. In the spirit of transparency, we have indicated through our press releases that we have approximately 4 cases, facilities that are associated with outbreaks. And we have been working really hard in conjunction with Duke University Medical Center to provide direct support of these facilities. Race and ethnicity breakdown for you all. We have 2.2% of our cases that identify as Asian, 39.6% of our cases that identify as Black or African American. We have 13.7% that identify as other. 20.3% of our cases identify as white. 23.7% are unknown, and 0.4% of our cases identify as Native American. 16% of our total cases at long-term care facilities identify as Hispanic or Latino. The continued efforts to reopen North Carolina involve 3 specific areas, and those are testing, tracing, and trending. I'm happy to report that Durham as a body is on track in all of these areas. A little information about testing. The overall goal of the state is to be able to test 5% of the population on a daily basis, and that equates to approximately 17,000 tests per day. And the state truly does believe that this is achievable. Durham's testing goal is roughly around 540 tests per day based upon the state's algorithm. And our partners and community advocates, such as Duke, has the capacity to test around 1,500 patients per day. Lincoln Community Health Center can test 60 patients per day. Durham County Public Health is working to gather all of our components, and we'll have that in place by the end of the month, which will allow us to test approximately 200 individuals per day. And a great partnership with Walgreens has allowed us to be able to test 160 residents per day, but that's on an by appointment only. And I'm proud to report that they have been testing since May May the 1st, 2020. Along the lines of contact tracing, our surveillance section currently operates with about 20 staff members, in addition to some great help from Duke. We have 13 Duke physician assistant students who've joined us for the past few weeks. They have been trained by us and they're doing extremely well. Duke considers this to be a phenomenal learning experience, and they actually have reached out in hopes of continuing this in the near future. I have also been successful in securing an additional 25 contact tracers through the state's partnership with Community Care of North Carolina, better known as CCNC, at no charge to Durham. This training for this new batch of contact tracers begins tomorrow on the 13th, with staff available as early as next Monday. So we also hope to have 5 contact tracers who are fluent in both English and in Spanish. Since March the 9th, just want the body to know that we've identified and contacted well over 1,600 contacts. In terms of training, our Durham County Coronavirus Data Hub is located on the Durham County Department of Public Health's website, and it presents accurate information that's updated on a daily basis. It's very important to ensure that our residents receive information from trusted and reliable sources, and there's none other better than our Coronavirus Data Hub. We've also included on this Data Hub the number of deaths at long-term care facilities for greater transparency. We also have entered into an agreement with Duke University Medical Center for secure data sharing, and it's been in existence for the past 2 weeks. We've used this data to create a school board, or we're trying to create a school board that mirrors the state's reopening school board. And of course, there's a few limitations, but we continue to work to make sure that Durham has all the information it needs to make great decisions. We've also updated the zip code mapping into a live map that will show where those long-term care or correctional facilities cases have contributed to the majority of the cases in specific geographic areas. In terms of communication and collaboration, we continue to maintain a great communication and relationship with Duke, as evidenced by the number of data sharing agreements that we've entered into in an effort to share critical information with not just each other, but also to the general public. We've also partnered with Duke in an effort to mitigate and contain COVID-19 outbreaks at long-term care facilities. And we continue to confer with Duke on a weekly basis as issues present themselves for opportunities for action. Finally, I'd like to just wrap up by saying we've done a great job with our stay-at-home order, and hats off to both the City Council and the County Commissioners for taking quick action and having us to be one of the top 3 counties in the state to quickly implement our orders. Our community spread remains low for a county of our size, and our order still requires face coverings while out in public, and we certainly encourage our residents to remain at home if at all possible, because that's the safest way to stay safe. Please know that good public health practices have made a difference in flattening the curve. Practicing social distancing, good hand hygiene, and washing and sanitation efforts, along with wearing masks and face coverings, have helped our numbers to remain steady. As we continue to move forward, ladies and gentlemen, I just ask that you keep in mind the new campaign, which are the 3 W's. Wear your cloth face covering, wait 6 feet apart, and avoid close contact. In other words, implement and practice social distancing, and wash your hand often and use sanitizer, preferably washing your hands for 20 seconds or more. I thank you once again to everyone for all that you're doing to keep Durham residents safe. And at this time, I'll entertain any questions you may have.
Rod, thank you for that great report and for all your work. So according to the protocol, which I mentioned at the beginning of the meeting, we have about 11 minutes on this agenda item. I'm going to begin with council members, city council members. I want to ask everyone to hold your questioning to 1 question, please, so we can get through as many folks as we can. And I'll open it first to city council members. Mayor Pro Tem?
Thank you, Mr. Mayor, and thank you, Mr. Jenkins, for your report. It's fun to actually see your face. I'm always on the calls with you, but I didn't know what you looked like. My question is, the Data Hub has been really helpful, and I've been able to use it a lot with referring folks who have questions. Is it possible to get the data on testing, the number of tests that we're performing per day on that site?
Yes, ma'am, it is. It's a very good question, Mayor Pro Tem, and I thank you for asking it. That's one of the things that we knew that we were missing, and it took a little clearing of red tape, if you will, to get the agreement in place with Duke University Medical Center in order to extract that data. To be very transparent, Durham is not like any other county or jurisdiction. We all are really, really struggling to determine our full testing capabilities and who all is testing, be it Mecklenburg, be it Cumberland County, Wake County. There are many individuals who are testing. However, there's not necessarily a central repository that will show us everything that's going on as far as the testing. We have no other choice but to rely on the state, Madam Pro Tem, and also our major healthcare system. But that agreement with Duke will allow us to be able to post and to better identify our testing capabilities. And we are committed to transparency and making sure that we get that information up on the Data Hub as fast as we can.
Thank you so much. Appreciate all your work.
Yes, ma'am.
Other questions from council members? Go ahead and ask them, or I'm not sure I can see you all on raising your hand, so go ahead and ask if you have one. City council members. All right, then I will now move to our school board members. Are there any questions for Mr. Jenkins from our members of our school board? Please go ahead and speak up. All right, and finally, our county commissioners. Are there questions for Mr. Jenkins from our county commissioners? Please go ahead and speak up. I see Commissioner Reckow with her hand raised. Go ahead, Ellen. Nice to have you here with us.
Thank you, Mr. Mayor. Rod, I forgot to ask this question last night during our meeting.
Yes, ma'am.
I have heard from neighbors and friends frustration that when they go to the supermarket, a lot of people are not wearing masks. A question would be, is there some template we could send out for a possible sign that people could put up as you're entering the store that would be eye-catching and just help to begin to convey the importance of wearing a mask?
That's a great question, Commissioner Reckow, and that's certainly something that I'd be willing to explore. I do feel as if we may be impeded by business practices and or those businesses, you know, their rules and obligations as far as posting of things. However, I'm willing to, I think as evidenced by, you know, the things I've said in the past, I'm willing to do anything in order to spread the word as far as ensuring that people remain safe and understand how important it is for face coverings and social distancing and you know, proper hand hygiene. So that is certainly something myself and my team are willing to explore. Conversely, Commissioner Reckow, I would also say that the reports that I've seen and the commentary that I've heard from the Triangle community is that they would much rather shop and do business in Durham because of the efforts of this city council and this county commission. The reports I've heard is that when they come to shop for groceries, they see more and more people wearing masks. They see individuals socially distancing themselves in various stores. And just another fact for you, I actually received a voicemail, a very rare one, in which there was an individual from Orange County who not only commended myself and my team and the elected officials for the bravery you took to take these steps, but to tell us that although she's an Orange County resident, she's doing all of her business in Durham. because of the steps that we've taken. And I felt that that was commendable, and I did want to express that all to you, that they're taking it seriously, and people are taking notice of Durham leading the way as far as keeping people safe.
Well, I agree, but what I'm seeing and hearing is that there's room for improvement.
Always.
On the next door listserv for my neighborhood, there was complaint after complaint about grocery store staff not wearing masks. Real concerns that people aren't taking this as seriously as they need to.
Yes.
The other thing that folks are concerned about is that one of my neighbors actually did a survey of restaurants that they wanted to patronize, possibly for takeout. And they called asking, were the staff preparing the food wearing masks? And they were getting no answers, and finally found a restaurant that said yes, and then they decided to order from there. So again, we have sanitarians who do inspections. I don't know if we could do more outreach to restaurants, just some feedback.
Absolutely. And we thank you for everything you're bringing to our attention. And
Okay.
as you said, there's always room for improvement.
Yeah.
This is an ever-evolving situation, and unfortunately, COVID is not going anywhere anytime soon. So we thank you for the wise counsel and the suggestions.
Thank you, Commissioner Reckow, and thank you, Rod. Other county commissioners have questions at this point or comments? Commissioner Jacobs?
Yeah, I just want to say quickly that I think the point that Commissioner Reckow raised is something that will be great for the Durham Recovery and Renewal Taskforce to really delve into. This is part of the work that we really have to do as a community, because when it comes to enforcement, we're really going to need to rely on our businesses and people in our community to really self-enforce. And I think, as Rod was saying, that this needs to be just, there needs to be more education. And when we look to these practices becoming more normalized for people and understanding that this is what we're going to need to do until there's a vaccine. So for the foreseeable future. So we do have a lot of work to do, but I'm looking forward to the roundtables and the task force really, getting, diving into this and helping to support the work of our public health department.
Thank you, Madam Chair.
Thank you very much. Any other questions from any of the members, commissioners, council members, or school board members? Please go ahead. We have a couple more minutes here with Rod. Ellen?
I just wanted to ask, because I joined the call a few minutes late. Wendy, did you add anything regarding the face mask project? Could we add that to the end of the agenda if we have time? Or
Sure. We can do that.
okay, thanks.
Steve and council members and commissioners, this is Minnie. We're not able to video. The host has not allowed us to video, but I do want to say that, Rod, thank you so very much. I haven't met you, but welcome to Durham, and thank you for your work with the health department. I was very interested in the racial divide that occurred, that you mentioned, and wanted to know, thank you, now you can see me, thank you. Wanted to know exactly what we are, if there's any effort, any concerted effort, since there's 30% of those who have contracted or those who have passed are of African American ethnicity. Are we making any inroads to look at the reason for that, and or any inroads to stop that spread?
Absolutely. That's a very good question, and I thank you so much for asking. Of great concern to me, not just for just deaths, but just infections and period. What I noticed was that we started off with student travelers, and that really kind of skewed the numbers and skewed our data for a little while.
Mm-hmm.
And then, of course, as COVID became a little bit more progressive within our community, it truly started to reflect the demographics of Durham. As far as the African-American community, I saw a number of deaths within the Black community at long-term care facilities.
Okay.
So that definitely spearheaded a call to action, and in working in concert with our phenomenal emergency management team within the EOC operations, we formed a long-term care strike force, a strike team, if you will, to better provide sanitation and nursing and just best practices in an effort to mitigate that. I think our Durham model has been a standard bearer for the entire state, and we're starting to see those efforts duplicated throughout the state. And we also work in concert with Dr. Cameron Wolf with Duke University Medical Center's infectious disease control area to actually go on site and to make sure that we were on site providing leadership and support in these efforts. Of concern to me now, to members of the council, school board, and county commissioner, is our Latino population. What I'm starting to see now is a strong uptake, and so much so to where we have convened our subject matter experts at Duke, El Centro, and a couple of other areas as of yesterday, in an effort to promote a little bit more awareness. We want to make sure that we get into all the nooks and crannies to provide that awareness that they need in an effort to ensure that they're getting the care that they need, and for them to understand that COVID-19 is nothing to run away from or be ashamed of. We want them to seek care. We want them to understand. So as a result, what we've done is we've done our videos in English and Spanish. We've reached out to our Spanish interpreters here at Durham County Department of Public Health, and we're trying our best to get even more advocacy and awareness around this for our Latino population. But to answer your question, ma'am, COVID-19 is an equal opportunity killer. And as it stands right now, it is affecting every demographic nationwide and within Durham. And our numbers are starting to reflect that accurately.
I agree with you, Rod, but when America gets a cold, Black America gets pneumonia. And even though, people may get COVID, we tend to die from it. It's just like breast cancer.
Yes, ma'am.
White women get breast cancer more than we do, but Black women die from it more. So I'm glad to know that there's a concerted effort to go into communities just to make us aware, provide that kind of education that we, because there was the rumor that was out there was that Black people couldn't get
Indeed.
corona. Indeed. So we had to finally get over that hump to now that we know people of color are more susceptible to it and are dying more because of the preconditions that we have and the living conditions we're in.
Yes,
so
ma'am.
Congregated areas, if we can get into our housing divisions, and that's why I'm talking to the city, county, we can get into these housing divisions and provide people with masks and some education to know what kinds of things they know that need to be healthy. Those are the kinds of things I'm talking about. Thank you.
Yes, ma'am. Yes, ma'am. Durham Public Health is here for you. Anytime they need us, we're here.
Thank you so much. And thank you everybody for those excellent questions and comments. Rod, thank you so much. I just want to say again how much we appreciate you. I can't imagine walking into Durham and getting thrown into a pandemic, but you've stepped into the breach and we're very grateful. Thank you.
Thank you so much, sir.
Before you move on, Mr. Mayor, I just wanted to, can you hear me now?
Yes, we can.
I couldn't get through, but I wanted to get an update on the number of beds that were available.
Okay, Rod, do you have that information?
I do not have that information on me at the moment, Ms. Freeman, but I'd be more than happy to get that information to you as soon as possible.
Thank you.
Thank you very much. All right, we'll now move on to our next agenda item. We are a little behind schedule, but doing okay. And this item is an update on the homeless population and outreach efforts. And I believe Colin Davis will be presenting today. Colin, are you with us?
I am, Mayor. Thank you.
Let's see, can you get yourself on the screen there?
Yeah, I turned on the start video. There we go.
There you go.
There we go. It worked.
Colin, welcome, and we appreciate you as well. We are very grateful for all the work that you've done, helping to lead the homelessness effort out of our Emergency Operations Center. So thank you, and go ahead, give your report. We also received your report prior and are looking forward to hearing from you.
All right. So if you've had a chance to look at the slides, I trust you've read them. I can give a quick summary of them. We can go through them, I guess. So where we are at this point, go ahead and advance. Thank you. So as you know, we've been able to move Urban Ministries, and thank you to Mr. Jenkins agreeing that it was a good idea to move the congregate shelter in its entirety to the hotel in an effort to try and prevent illness, rather than waiting for some people to become ill and start moving people as they got ill. So that's how and why we moved to the motel. At this point, we have had 0 cases of COVID-19 in the homeless population at the hotel, which is a wonderful thing. As you know, we've been working to increase capacity at Urban Ministries at the hotel, and we had to reduce capacity in order to achieve social distancing while we were lining up the hotel. So now we're in the process of ramping back up to capacity. And as of last night, the current census at the hotel is 141 people, which is great. They're moving really quickly to refill slots. As we get back up to this 150 number, we will have some challenges as we start thinking towards the end of this hotel stay. At some point, we will be moving people back to congregate shelter. And as we think through that process, we will need to go back to shelter capacity, which will be a much reduced capacity at the end of this hotel contract and when it's time to go, depending on social distancing guidelines. At this point, assuming the social distance guidelines stay in place of 6-foot spacing, we could see Urban Ministries, when it's time to go back, being at roughly 50 to 60% occupancy. And that's going to affect single men, single women, and families very differently. The families at Urban Ministries have private bedrooms, so they won't see a decrease. The men and women who are single adults share congregate space. That congregate space is where that social distancing is going to be critical, and we could see substantial decreases in the numbers of people who will be able to return to Urban Ministries from the hotel. With that said, we as a continuum, and we are looking to move people into permanent housing, which is a great thing. So we're working through the process of getting our rapid rehousing process streamlined and moving more efficiently as a system to get people into permanent housing. So that's where we are on sort of that emergency shelter piece. With that said, if you want to advance to the next slide, as we go back to congregate housing, there's still always a possibility that we will run into people who get ill. If people do become positive with COVID-19, they're not going to be able to remain in a congregate setting. If they're not able to remain in a congregate setting, we're going to need a safe place to move them to. And that's where we're trying to find an isolation or a specialized hotel or other facility. So advance. One of the biggest problems that we've had, a lot of people have been asking for this isolation hotel or a specialized hotel for people who are ill. And the problem has not been the hotel owners not willing to do it. It's a perfect storm of their frontline staff being scared and have already either quit work or threatening to quit if we bring in people who are COVID-19 out of safety for themselves and their families. And then you've got lawyers and insurance companies advising hotel owners that they really should not mix their guests, despite public health has worked with the homeless team to set up protocols that will mitigate risks to everybody. And I will commend Mr. Jenkins was on a phone call with me and Drew Cummings and Leslie O'Connor from emergency management with a hotel owner, really trying to work through, here are protocols, here are things that we can do to keep people safe. And still it came back to, we want to help you, but you're going to have to take over the entire hotel, which becomes very cost prohibitive. So if you want to go to the next slide. So now that we've identified that we've had, challenges with renting room, a few rooms or 10 rooms at a time, we're exploring non-conventional options, looking at where are some other places that we ordinarily wouldn't look to create this isolation in a safe place for folks. And how do we ensure that when we exit the facility, it can return to being clean and healthy? So there's a lot of pieces of offering county resources or bringing in third-party vendors to help ensure frontline staff that are responsible for cleaning are not having to clean the rooms. And if they are going to clean the rooms, making sure that they have the appropriate PPE to do that and the appropriate cleaning supplies. So that's where we are on those. And I believe next advance. And I think that's it. Just a very brief overview.
Thank you so much, Colin. And as I said earlier, Colin, we're so appreciative of you. And like Rod, you also came into the city not long ago and were also thrown into this situation. And we really appreciate your leadership. Thank you so much.
You're very welcome.
Now we're going to have questions for Colin, and we're going to start this round with the school board members. Are there any school board members that have any questions for Colin about how we're dealing with our homeless population? If so, please speak up. School board members with questions for Colin? Okay, we will now move to our city council members. City council members with questions for Colin. Anyone? Okay, county commissioners. Commissioner Reckow. We can't hear you, Ellen.
Thought I unmuted.
We can hear you now.
Yep.
Okay. So thank you for that report, Colin. You referenced when we leave the hotel, we have a contract with the Marriott. When does that contract expire?
The current contract expires July 8th.
Okay. And the way you're talking, it sounds like we're not either interested or able to renew that contract. Is that true or not?
I don't know what the answer to that question is. That's something that would be outside of my decision making. I assume that there would be, if the county and the hotel were agreeable and wanted to continue operating, that it could be extended. At this point, that's the current date. And whatever the date is, we're starting to look at what is the exit strategy so that because it takes time to exit 150 people from a hotel, because we'll need to slow down new admissions. We'll need to stop taking new admissions to the hotel at some point. So it's just trying to back up from whenever that date is, whether it's July 8th or some other date.
Mm-hmm. So what would be helpful, it seems, would be to work with our public health department to see, are we tracking from emerging case point of view and other indicators, such that it looks safe to move back to congregate and, have the transition, as you say, be smooth. On the other hand, if, for example, we don't continue to trend down, but hopefully this does not occur, go back up at some point in June, then we need to see what the options are, right?
Mhm.
Do you have a target date that you'd be looking at in terms of making that decision sometime in June, in terms of whether we're looking at trying to extend versus go forward and make the transition?
I believe that date is really outside of the homeless system's control. That's more of a FEMA and public health decision.
Okay.
In terms of, like you referenced earlier, when is it safe? When is it appropriate to start moving people back to a congregate facility? So we'll be really listening to what our public health department says and what FEMA is saying. And I think recommendations will be made based on information as that comes.
Okay. Well, I hope the leadership involved, Wendy and Steve, others will look at that very carefully over the next month in terms of how we're tracking and whether it makes sense. Thank you.
Agree. That's very important and appreciate those questions. Other questions, Commissioner Carter?
Thank you. And Colin, thank you so much for your work. I know you must be feeling like this isolation hotel is the bane of your existence. And I'm sorry to ask a question about it, but what if today someone in the Well Hotel tested positive? I know we don't have an overall plan for how we deal with that, but do we have a short term? What are we doing on a case by case basis if something like that happens? It's bound to.
My understanding is Public Health and Duke have a protocol in place for.
You went out on the left.
Sorry. My understanding is Public Health and Duke Medical have a plan that can handle a small number of people who test positive. What we're worried about is if we get if there's an outbreak at the if there's an outbreak at the Healthy Hotel, that would be problematic. It seems that there's a protocol in place, from my understanding, to handle up to maybe a handful of folks.
Okay, well, thanks for your continued dedication to finding an isolation space, unconventional as it may end up being. We certainly need it. Thank you.
You're welcome. We'll get creative.
Does anyone else have a question for Colin? Any members of the school board, the county commission, or the councils, please speak up. Commissioner Jacobs.
Yes, I first of all want to thank Colin and all the members of the housing security team that have been working so hard on this. And I think as Commissioner Reckow has acknowledged, and Commissioner Carter and you, Colin, this is going again to be a long-term issue that we have to come up with a plan for the long term. And, in terms of us, keeping this model, I don't think it's financially sustainable. We're spending, the county is actually spending more than $2 million just for this hotel to the end of July. So it's a very very expensive model that we're using, which I'm really proud that we took action to very quickly move people, and thanks to everyone's work on the ground making it happen. But I'm glad that people are looking at some creative solutions with a focus on getting people into housing. I think that one benefit of this crisis we're in is let's think about some systemic changes. Let's think about investing in putting our money into long-term solutions around our housing crisis and homelessness. So it makes me feel good to know we have people like you, Colin, working on this. And I hope our community can really pull together with what some of those much more sustainable long-term solutions there are for us to really invest our resources into.
Thank you.
Thank you very much. All right, Colin, thank you, and appreciate everyone's questions and comments, and we'll now move on to our next agenda item, but we appreciate you. Thank you.
Thank you.
And looking forward to the progress on the isolation hotel. Thank you.
Keep you posted.
All right, our next item is the update on emergency feeding of Durham Public School students, families, and seniors. And this presentation is by Donna Rewalt. Donna, welcome.
Welcome. I'm wondering if you can undo my video, Diana, so I can make, it says the host has stopped my video.
Okay, I don't think that's Diana, but it's a tech person.
Or whoever the host is, yes.
Yeah. Somebody's gonna, can somebody let Donna Rewalt be seen?
Okay, I think we got it. Okay, we
There
got
you are,
it.
Donna.
Okay,
Good.
hi, good morning.
Donna, before you get started, I want to add my appreciation to you. You've really done a great job shepherding all this food work ahead, both for the public schools, for our seniors, and you helped us figure out how to reopen the farmers markets, and you've just done a wonderful job. I want to express my appreciation. I was on a call recently. You run a fantastic Zoom meeting, Donna. I was on a call recently. I think you had 40 people on there, and you just do an outstanding job. So thank you so much, and looking forward to your report.
Okay. Thank you, Mayor Schewel, and good morning, Commissioners, City Council, School Board, and residents who are tuning in. I want to say first and foremost that feeding Durham is a massive effort. I do co-lead this work in Durham County with Kelly Warnock from Public Health, who's a nutrition program manager, and also with Michael Davis, who's our strategic initiative manager for Durham County out of the county manager's office. None of the feeding of Durham residents would take place, however, without the work of our wonderful nonprofit community. I'm going to talk a little bit about that today. So if we could start the slides, that would be fantastic. And we could advance that one. So advance to the next one. We can, hopefully. I'd like to start by grounding us slightly in some data. I think most of you who are here know that hunger and food insecurity has been with us before the COVID crisis and has been exacerbated by the crisis. These are numbers prior to COVID. At the time of COVID, we had approximately 16.5% food insecurity in Durham. In our public schools, 64% of our students receive free and reduced lunch. And we also, from many of our data points through our community health assessment, other points of data, we know that 20.9% sometimes skipped or limited meals, particularly in our Hispanic or Latinx community. Next slide. 1 in 4 residents at that time also had low access to a grocery store, and $700 would be a low-cost monthly food budget for a family of 4, just to give us some idea about what kinds of expenses we're talking about. Food insecurity in North Carolina, according to a recent study in late March 2020, is now at 40.7%, and that's a statewide number. You know, we haven't gotten down to that granular level, but we certainly know that food insecurity in Durham has certainly increased dramatically over this period of COVID-19. Advance. So I'd like to give you some updates on some of our feeding efforts, and then kind of give you a perspective on some issues and some things that we've been thinking about. I think that also as public officials will be useful for you all as well. First and foremost, we do convene a weekly task force meeting with over 40 community partners. I think the last 3 weeks, our calls have ended up somewhere upwards of 50, and those are individuals, whether they be food pantries, churches, other folks who are involved in feeding Durham residents. We convene that meeting to share resources and provide collaboration. It's been a really rich opportunity for people to come together around feeding Durham. We welcome, I think some of you have also been on those calls. We had Mayor Schewel and Commissioner Jacobs talk to the group the other week, which we greatly appreciated. So that's something we do every week on Wednesdays. We also know that one of the largest feeding efforts in Durham has been the collaborative effort known as Durham Feast with Durham Public Schools, Durham Public Schools Foundation, and others working with restaurants to serve via 24 community locations. As of May 8th, 220,192 meals have been provided. Around 5,700 children served per week on average. The average I shared with the commissioners last week was a little bit higher. You may know that with ebbs and flows of benefits, you have greater and lesser demand in the course of a month. When folks receive benefits, they may be less likely to seek meals because they're able to provide that for themselves. So the average is slightly lower after last week than it was the last time I presented this information to you all. 2,600 adults are served per week on average. We know that this initiative will likely evolve to a new stage in June. DPS will be starting their summer feeding program. I do know that I cannot give you more details on that at this time. I know that there is a meeting between the Durham Public Schools Foundation and Durham Public Schools today to talk about the transition to that feeding program and what that would look like. We do hope, in talking with the foundation, I know with the support of the city and other partners, we do hope that some of the adult feeding companion pieces and the delivery component that happens on Wednesdays could be continued with the Durham Public Schools Foundation. I do know that they will be looking for some more human resource organizational support. So for example, they do have other work that they need to do. So they had mentioned that having somebody help coordinate some of those adult feeding opportunities when we move into that June time period will be essential. I think all of that will become more clear this week, and perhaps there will be some other conversations around how that can be supported as we move ahead. That's been very successful, and we want to do everything we can do to see it continue because the food security issue does not abate with the end of this month. Advance. We've also seen with food security, because we have chosen a strategy, of working directly with nonprofits. Some counties are, pulling up Mack trucks to the back of their county building and feeding folks from their county parking lots. We have a wonderful network of partners who are already feeding people. They efficiently know how to get food to the community, but they need help doing that. So they need volunteers. Some of them have participated in a partnership we have developed with the Triangle Nonprofit Volunteer Leadership Center called Feeding Durham Together, which is a food security volunteer portal. It also, there's also a portal for senior needs and some other activities around COVID-19. Through May 9th, we have had 128 volunteer placements, which is 85 different people in different feeding sites. So we're reaching some of the feeding sites. Durham Feast has a large scale volunteer recruitment that's kind of separate, but some of these smaller food pantries really need support, and we've been able to place volunteers that way. We're pushing that out there in the community, and we hope you all have seen that and are able to share that as well. It's a great resource, and the Volunteer Leadership Center has been a fantastic nonprofit partner. We've also recently had to implement a feeding plan to serve food insecure COVID positive families. There are a variety of organizations helping with this effort. Part of it is also, I think one of you mentioned earlier about privacy and security. So we are definitely making sure that processes like this are HIPAA compliant. So if we're feeding families, that those identities and details are protected as they should be. We also are sharing information with organizations and food insecure populations around the pandemic EBT benefits. Some of the people who will receive those benefits, such as people who receive free and reduced lunch in Durham Public Schools may or may not know about benefits. They may not have received benefits previously. They may not know what this card is about, even when they get the information that comes with the card. So we're doing some additional education around that. We're also promoting triple bucks at farmers markets, both South Durham Farmers Market, SoDo Farmers Market, and the Durham Farmers Market downtown do triple bucks for SNAP and EBT customers. And so we want to make sure that's promoted, which basically means $1 is $3 at the market. And that's a wonderful benefit, as well as other resources that we're sharing. Advance. So one other wonderful benefit from our city and county GIS department is that we do have a new GIS map. This was actually being developed prior to COVID, and we accelerated its development and implementation with the onset of COVID. So if you go to, we have In Hunger Durham is hosting the map. If you look at the map, you can see all the locations of the feeding sites. And if you click on the feeding sites, you can see their dates and times of operation. Both public health staff along with In Hunger Durham staff have been monitoring changes. One of the great things about our Wednesday calls is people do mention changes. So times, dates, locations have changed. We're able to update that map. You can enter an address and get the feeding sites that are more closely located to you. It does also include farmers markets, grocery stores, and other types of food opportunities. So it's a wonderful resource that's being updated regularly. It's probably the best source of information right now about feeding sites in Durham. We also, as you heard Mayor Schewel allude to, we've also strengthened local food access through implementation support of our farmers market COVID operating guidelines. We do run a farmers market, I guess, subcommittee or team, call it a farmers market team of the task force, where we are working directly with markets to reopen in some cases, because we have some markets that aren't open, and to help support them with the guidelines. We do have an environmental health expert who also serves on that team, along with personnel from Durham County Cooperative Extension and Durham County Soil and Water, who are also working with us to support these markets. You know, it's been very interesting because what COVID has done in many of our food systems has brought up issues of things like packaging. You know, people who haven't had to package something before have to package something. You know, people who package things in larger quantities now have to package things in smaller quantities. And it's an interesting thing that we have. It's not just about the food, it's also about the things that, and the supportive systems that surround that food that we've had to help folks address. We also have connected Durham County farmers to food security efforts through an adjustment of agreement the county has with Farmer Food Share, which is going to enable more Durham County produce, meat, and dairy to get into the mouths and hands of Durham County residents who are food insecure. So that's a wonderful thing we've been able to do. We're also currently in the middle of a farmer survey, which is designed to do a couple of things. One, identify food that is available to be purchased, but also identify food that's available to be donated. You may have seen on national news information about food waste, and that has also happened some here in Durham, and we're trying to avoid those types of situations from occurring, as well as providing just some general support to the farming community, identifying places where we do have losses and challenges. Advance.
Donna,
yes.
Before you leave that map,
yeah,
what's the difference between the gold dots and the green dots?
You know, I don't have the map memorized, but all of them are color coded. So farmers markets and grocery stores are color coded differently from a feeding site. So when you actually go to the map and you see the different categories, you can see which things are which. And I don't remember which color is which right now. Yeah. Okay. So when you actually go to the map, you will see how that's laid out. So
there's yes. more gold dots than green dots. Does that help in terms of discerning which is?
No, it does not. I'll ask one of. I'll ask Kelly or Michael if one of you guys will text me during this and tell me which is which. I'll let you know. Yes. So some of our emerging issues that we've noticed. so part of it's understanding and supporting financial needs of smaller pantries, which are sites for purchasing food and meals. So, they have seen increases, but kind of evaluating what those are, how we can help them. The Food Bank of North Carolina, Interfaith Food Shuttle, and other larger partners that provide food to pantries have been invaluable. But we also just are trying to make sure we're able to support pantries with the needs they have. Monitoring food supply issues, we've been asked certainly by our emergency operations to be aware of that. The one notable one I give as an example here is the shortage of family-sized canned food. So a can of soup that is 14 to 20 ounces versus the kind of institutional cans that a cafeteria or school would use that isn't appropriate for a family. Those are certainly widely available, but it's those smaller size cans that have been difficult sometimes for pantries, for the food bank, and for others to get a hold of. Hopefully that will improve, but that's also been noticed above along in other states as well. We do have an ongoing need to access PPE. We do in our task force, we do have some community sewers who are providing homemade masks that we are then, I think we just got another 100 this week, that we are then providing back out to our food partners. But that's going to be an ongoing need, as well as information supplies for sanitizing and safety and cleaning supplies for feeding sites. So we certainly are in communication with them. We've definitely shared the best guidance from experts about feeding site operations in terms of safety. But that's going to be an ongoing need. Also, just the need to address local food system coordination, so providing support for things like good agricultural practices certification for farms, and then also finding new ways to track data on hunger as the crisis evolves. That's actually something, if you asked me, and you may, how many people at Durham are hungry, I can't answer that question. It's very difficult to answer. Partially because the crisis is unique, and partially because we haven't tracked that in that way. We don't track the increases that food pantries have experienced down to that level. So we are working with some folks to start to get a better handle on what and where hunger is taking place. What does it look like? Where is it happening? We don't have a lot of structures in place. We didn't have a lot of structure in place to start with. So this is kind of a new territory for us, but we do see that as an emerging issue that we want to tackle. And you can advance. So some opportunities that we have, I think this is related a little bit also to the data point, which is that this COVID emergency highlights a true need for year-round comprehensive countywide effort on food security. We don't really have a structure around that, and we see that as an opportunity for the county. If we'd had that, that would have helped us get a quicker start, for example. Supporting senior feeding needs. So we've done a really good job with families and children, but what we know is that our seniors are the most vulnerable population to COVID. And so we've really started to take a deeper look at that and worked with partners such as In Hunger Durham through Durham Congregations in Action, Meals on Wheels. Last night, the commissioners approved funds both for In Hunger Durham to feed seniors in subsidized housing in Durham, 900 seniors in subsidized housing, and also funds to Meals on Wheels to take more seniors off of their waiting list. Meals on Wheels waiting list has increased dramatically. It's now upwards of 450, and the funds we contributed last night from the county, I think will take at least 100 people off that list for a few months. So that's exciting that we're starting to take a deeper look at that. We're looking at funding sources. Certainly these organizations are applying for the Duke resources. FEMA reimbursement is possible. I've shared the FEMA guidance, I think, with a lot of you. So you can see that FEMA prioritizes seniors as a population for feeding assistance. Also our county and city partners, you may, city council members, you may know, Mayor Schewel asked me to send a companion request for the End Hunger Durham food relief and subsidized housing, which you all should have received. And that's the other half of that the county commissioners approved last night. Also donations. I mean, I think senior, we've had some conversations. Senior feeding has had a lower level of donations. I think it gets a little bit less attention. It's a, maybe a smaller group of people than our larger family populations are, but it is definitely a critical group for us to support at this particular time, because they are individuals. We really don't want our individuals in subsidized housing to be going out to stores and to be going out and exposing themselves in the community. So we really want to enable them to shelter in place when they need to. We also have been looking at how to address undocumented and refugee populations. We've been working with partners around that, and we're diving deeper into that. One of the things we're doing this week is actually looking at translating some of the materials and information about things like pandemic benefits into languages that are beyond English and Spanish, that reach some additional populations that our refugee organizations have identified as well. Also assisting the Latinx community. We did contribute some funds last evening from the commissioners to El Centro Hispano to feed families through the El Centro's programs. And we're looking at working with other food pantries and individuals who work directly with that community. What we do know is that in terms of household income reduction, based on studies, the Hispanic Latinx community has experienced the highest levels of reduction in household income. Recent AP survey, for example, indicated that 61% of Latinx households indicated some type of reduction in household income, compared to 46% of Black and 43% of white households. Dramatic numbers for all populations, to be sure, but we do know that the job loss has been of particular note in this community. Advance. And then just a few high level things we just want to, I think some of these kind of.
Donna, this is Steve.
Yeah.
Let's try to move quickly through these, okay?
Okay, very quick. So just a couple of things: the nature and location of needs in Durham, understanding the resources. I think understanding what the opportunities for reimbursement are, determining level of effort. It's difficult to assess all of this, and so we need to understand better how to address it. Using flexibility and innovation to develop quick responses, because our typical emergency approaches of congregate feeding do not work. Accelerating the speed, and I think this is probably one of the important ones, at which staff and government systems can align within and across government entities to respond. And I think that's a good one for the future.
Donna, thank you very much. I appreciate that.
Sorry, lots of information there.
That's all right. Great report. Donna, again, thank you so much for your leadership efforts. You've done a wonderful job, and just the fullness of this information really expresses that. And thank you to you. You mentioned Mike and Kelly and all the members of your group. It's been a wonderful effort. I'm now going to open up questions first. We only have about 5 minutes for questions and comments on this item. I'm going to open up questions first to our members of our county commission. Any commissioners that would like to be heard? Commissioner Reckow?
Thanks, Donna. Great work. One question, and that is regarding the summer feeding. We have other partners that I don't think you mentioned that traditionally have done summer feeding. The Durham Children's Initiative has done summer feeding every summer. I don't know whether they're doing it again this year. Hope so. And then the library always had a lunch with kind of a community read session that I enjoyed participating in quite a bit. Do you know whether those partners are available this summer?
We do not, and that's kind of our next step is kind of figuring out what that next. That's been one thing about the situation. We've been dealing with the now, and so we're starting to get a little farther out. So we will definitely look into that and let you know.
Okay, it'd be great to both DCI and the library combine the feeding with an educational component. And so.
And I just received a note that says the library's meals are sponsored by DPS, and they're not at the libraries. They will only serve at the schools. So that's the note that I received. So.
Okay. All right.
Thank you. Thank you for the question. Thank you, Donna. Commissioner Carter?
Great report, Donna. Wonderful last night as well. I feel really strongly, after sitting in on a couple of these task force meetings, the 40 or 50 people, what a courageous and amazing group of people, that the work that's happening is so important, and it's so labor intensive and time intensive to try to coordinate it, like you said, Donna, across entities, within government, across government, with non-governmental agencies, et cetera, that we really need to figure out between the city, the county, and the school system how to have a person to champion and drive this work going forward, not just now in this time of crisis. I mean, frankly, hunger is its own pandemic that we've been dealing with forever, and great work is happening now, and I just hope we can sustain it. And I think it's going to require a position that we're going to have to fund, and then there will be someone to help us create a community food security plan, looking at the whole entire food system. And that's a really vast responsibility, and one I think we're going to, all of us have to put our heads together and figure out how to take on. I just want to say that.
Thank you. I do think the level of staff effort is tremendous, and we have 3 people who have other full-time jobs who have a new full-time job, and I recognize that that's not probably sustainable. We do need to do those other jobs as well at some point. So yes, there's a more structure. I mean, this is pointed out time and time for us that something is needed that would keep this something that functions year-round on a continuing basis. Yes.
Thank you so much for that. We have time for one more question. Anyone? Commissioners, Councilmember Freeman.
Thank you. Thank you, Ms. Rewalt. I appreciate your work, and I know you always run a good meeting. I wanted to ask specifically, I have some clarity around how the funding is set up for this, but I'll come back to that. My specific point was around the data points. And I noted that you mentioned that you were trying to figure out how to get down to, I guess, the pins and needles in it. Can you make sure to include race as an aspect?
Oh, yeah.
Along with age?
Yeah, absolutely. That's definitely part of that. Yeah.
And then also just along the lines of funding, am I understanding correctly that you're saying the DPS is funding this food initiative, or is it the county?
It depends on which part of it you're talking about. So if you're talking about the senior pieces, that's the county, and then private funders that the organizations have procured previously.
Okay.
And then the DPS effort, of course, is, and then Durham Public Schools Foundation. Some of that is the kids' meals are reimbursable through the typical sources with USDA, but the adult meals are not. So that's where that fundraising has come in, because schools do not provide adult meals; they provide meals for children.
It would be great to see that breakdown, and to know who's doing the heavy lifting and funding this type of effort.
Yeah, it's a little bit of everyone. It's a little bit of everyone right now, for sure. And to go back, I did want to say, if you did want to know about the map, orange was kids' meals, the green was farmers markets, the blue was food pantries, and the purple was grocery stores. So I did receive that information.
And where is that map available for us on the web?
So if you go to In Hunger Durham, you can just Google In Hunger Durham. It will be on that main page, and we'll mention the map, and you click on it, and then you'll actually get to the active GIS map.
Thank you. Donna, we're going to move on to our next agenda. I want to appreciate everyone's questions, and I want to appreciate your report. Thank you so much. We're running a little behind, but maybe we'll catch up. Okay. Now we're going to move to our next item, which is an update from the working group for the next 60 to 90 days for City, County, and DPS. And I believe that the presentation is going to be by Bertha Johnson and Jodi Miller. And we're glad to see you all here. Jodi, I see you up on the screen. And I see you, Bertha. Great, thank you. Wow, what a fantastic team. We're so lucky to have you all. I can speak from my very close personal experience with Bertha, what an amazing manager she is. And Jodi, I know that you have exactly the same kind of skills and abilities, and we appreciate your efforts also on our Emergency Operations Center. So thanks to both of you all. This item is allocated 15 minutes on our agenda. So go for it.
I believe I'm going to start. So I'll say good morning, Mayor Schewel, Chair Jacobs, Chair Lee, City Council members, Board of County Commission members, and Board of Education members. The 30, 60, 90-day work group, which we've been calling ourselves, is probably one of the first groups to start a discussion on issues and needs related to the COVID-19 response related to our respective organizations. At the suggestion of City Manager Tom Bonfield, the group was created. Representing the county are Michael Davis and myself, the city, Bertha Johnson, Ryan Smith, and Monica Chaparro, and in DPS, Dr. Julius Monk and Ken Barnes. We've had several virtual meetings over the last 7 weeks and where we've identified issues of mutual concern to the pandemic and opportunities to partner. Discussions and issues have been narrowed down to 3 focus areas for our group. The first being governmental and educational operations. The second, food security, which you just heard an update from Donna on the work and efforts to date on that. And the third being education and youth. One of the real strengths of this work group has been the information sharing to ensure efforts and strategies are aligned and to prevent duplication of efforts. I'll share a little about what the county and DPS have been working on, and then I'll turn it over to Bertha to share updates from the city and information on a pilot project we're investigating. The county is currently working on its reopening strategies to ensure that its workforce stays healthy while providing essential services to residents. Example of this work includes implementing screenings at county facilities, creating strategies for remote and virtual meetings when possible, and implementing social distancing practices and flexible hours of operations. Updates on our efforts will continue to be provided as this work continues. DPS is also working on its strategies for reopening with its summer meal program scheduled to start again in June, which you just heard about. Learning how to social distance in a traditional school environment will be a challenge and will require the support and guidance from both the county and the city. Finally, I mentioned that information sharing and coordination are critical as a path forward to recovery and renewal is created. This group, as well as the Emergency Operations Center Recovery Committee and the Taskforce for Recovery and Renewal, will be working on recovery strategies for different aspects of our community. I will serve as the liaison for all 3 groups to ensure that alignment and coordination of effort and best practices as we determine what a new normal for Durham looks like. So with that, I'll turn it over to Bertha and Ryan. Bertha?
Good morning. Monica Chaparro, the Assistant Budget Director, is leading this initiative for the City of Durham. She and her team have created a wonderful process to tackle this problem in a methodical and collaborative way with our departments. We wanted to make sure that we're actually working with our departments. We're listening to them as they listen to residents and their employees. Our process is focused on 3 specific areas. 1, exploring strategies and prioritization for how city will return services and programs to normal service levels. 2, examine how responses to COVID-19 might impact the organization over the next 30 to 90 days. And 3, and very important, we want to better understand how our department's future service delivery might be impacted or reimagined as we move forward, because we don't know what's going to happen in the future. We have found that some of our departments have changed their service delivery methods and are thinking about how they can continue to do it in that way. We also are currently focused on just objective 1 and 2, and we will work on the reimagining aspect later. We're really looking at how we can work with our departments in terms of them thinking through how they prioritize service delivery and how they think about this in the long term. some of the information we're collecting is, what's the priority for making changes to the current service delivery method? What are the current service delivery methods? What do we want to change, and when do we want to change it? For example, our departments are prioritizing those in terms of what's urgent, what May, what is intermediate, June, what is long-term, longer than July. One of the most important aspects of this work, I think, on the city side is our racial equity and inclusion manager, Sharon Williams, is involved in this process to ensure equity and ensure that we're looking at access issues as well as how this is impacting our marginalized communities. We are hearing a lot, and of course are collecting information from our departments on what are issues related to PPE, facility modifications. We're talking about plexiglass and other ways that we can keep our employees and residents safe, and technical support for our departments in doing a business in different ways. We have a focus on Durham One Call in the Office of Public Affairs, because we want to make sure that we are communicating to our employees consistently and our residents consistently to ensure that we're bringing them along with us. So for the sake of the time, I'll leave it at that, and I'll turn it over to Ron Smith to share a great initiative we're focused on around stimulus funding.
Thank you, Bertha. Can everyone hear me? Good morning, all. Ryan Smith with Budget Management Services. A very brief update on our efforts to help residents access federal stimulus payments that were made possible under the CARES Act. You may know that in order to receive a stimulus payment, individuals had to file taxes this year or last year, or receive certain types of federal benefits like Social Security benefits, SSI payments. For individuals who do not fall into that category, they have to file taxes, and that means that some of our residents who are eligible will not receive a stimulus payment unless they receive some assistance. So we're currently pursuing 3 strategies. The first one is we're trying to provide a better information locally from a trusted source to let residents know the steps they can take themselves to get a stimulus payment or to check on the status of that, as well as how they can avoid scams. We have heard both locally and then across the country that there have been an increase in efforts to fraud, to call residents and get them to disclose private information. And so we're trying to raise awareness around this. We have a website that we launched recently called www.getyour1200durham.org that provides, again, step-by-step information that residents can take, as well as tips on how to avoid scams. And I've been partnering with our city attorney's office on that website. Our second strategy is focused outreach on residents with no income or very low income. And we are focused on 3 specific populations. We're focused on partnering with Durham DHA to work with residents in public housing. We're working with community development on residents who are staying in our emergency homeless shelters. And we're also working with residents who are recently returned home from prison. This is an important strategy because individuals who earn less than $12,200, or if married, $24,400, as well as individuals with no income, do not have to file taxes, but they do have to go onto the IRS website for non-filers and provide some basic information. The best thing about this is it doesn't require a tax professional to help someone through this process. It's fairly straightforward so long as an individual has a Social Security number. So we are working with these 3 groups. We are starting this week. We've been working with staff from DHA to plan a mobile unit that will go throughout DHA properties to assist residents with understanding this process and using the non-filer portal to receive a stimulus payment. That starts this week, and then we'll be rotating throughout DHA properties. Our Welcome Home program, as well as other reentry service providers, are beginning to support returning residents. Our own Welcome Home program has already assisted 15 recent residents who have recently returned home from prison and using the non-filer portal to access a stimulus payment. And we're continuing that work and helping others to do it. And then we are, again, working with community development and with other partners to develop a strategy to support homeless individuals in Durham with access to federal stimulus payments. Hope that work will begin later this month. Are able to do so. We have been partnering with reinvestment partners to launch, to reopen a Vita site at Northgate Mall. The goal is to reopen that site in June, and we are working with our Durham County Public Health to review plans this week for reopening that site to make sure that we can do so safely, both for the staff who will be running that, as well as residents who will be coming to it. I can share a memo after this, but that's just a brief update on our approach and thinking around how to ensure as many residents who are eligible as possible receive a federal stimulus payment. Thank you.
Ryan, thank you so much. Jodi, thank you. Bertha, thank you very much. Great report. We have just 5 minutes for questions on this item. And I'm going to ask city council members if any of them would like to begin with asking questions. Any council members? Councilmember Freeman.
Thank you, Mr. Mayor. I appreciate learning more about this 30, 60, 90-day task force. I just have a concern recognizing that the old norm had a lot of disparities in it. It would be nice to know how race equity is going to be taken into account across the board. I know that Bertha brought it up to say that there would be some ways to kind of piece that in there, but I want to make sure that it's not left till the end and it is actually at the forefront.
Councilmember Freeman, I'll just say from a county's perspective and also the work that the EOC is doing, that's a very important piece of our work. We just hired our racial equity officer who started this past week to join us, and we've already integrated her work and her experience into some of the work that we're doing. So it's a priority for the work that we're doing at the county, not only on the 30, 60, 90-day reopening strategies for the county, but also the larger context work that the Emergency Operations Center is doing for reopening. And my understanding is that the Task Force for Recovery and Renewal that will kick off its first meeting this Friday, that'll also be an important priority for the work that's being done.
And I'd specifically bring it up because I think that in general, folks tend to think that one person can handle that job, and it's not a one-person job. It needs to be something that's looked at across the board so that people in the actual areas, like if it's the health department, that someone in the health department is looking at it. If it's someone in budgeting, it's someone in budgeting that has an understanding around race equity that's looking at it. And so it's not one person, and I really want to make sure that that's weaved together beforehand because I know what came out of Katrina, and I don't want to see the same thing coming out of COVID.
Thank you, council member. And thank you, Jodi. Any other questions from members of the council first? Any city council members have questions? Any school board members have questions on this 30, 60, 90-day task force? Please go ahead and speak up if you do. I can't see everybody. All right, and any county commissioners? All right, thank you all very much. I really appreciate this work and it's so important. And I'm just really grateful for the foresight that both the city, the county, and the school board have had in planning. I want to say, just add, in terms of Ryan's report, I want to thank Ryan for really pushing hard to try to get this VITA site going. It's great, and I'm so glad that Reinvestment Partners has stepped up to do it. It's going to really help a lot of people in Durham be able to access their stimulus checks as well as earned income tax credit, and it's geared for the people who really need it. And so, thank you so much, Ryan. Thanks to Monica and all of those of you all who are leading this work. Thank you so much. All right, we'll now move on to the item 6, which is report on COVID-19 Task Force on Recovery and Renewal. And this is just a 10-minute item, and I will give a brief report, and then Commissioner Jenkins may want to add something, and then we'll have questions and comments. As you all know, we need to act quickly to figure out how to be able to safely and gradually reopen our businesses and our places of worship, our nonprofits and other institutions. And we also need to make sure that when we do that, as we reopen, everything is done safely and with best possible safety and health practices. And so to that end, we established the Durham Recovery and Renewal Task Force. And we have appointed them to advise Wendy and myself as we revise and amend our emergency declarations and stay-at-home orders, and to advise our community on how to safely, gradually, and successfully reopen. The task force will have a 100-day period of service. It's not to have a big final report at the end, but rather to work on a real-time basis to make recommendations to our community in concert with our community. The task force meetings will be public. They will be, the first one is scheduled for this Friday, May 15th at 10 o'clock. And they will be noticed as usual for public meetings. The task force has 15 members. It comprises public health experts, business leaders, community and faith leaders. And Jodi Miller, as she mentioned earlier, will be the representative from the county's Emergency Operations Center. We are thrilled to have a great group of leaders to chair this committee, as well as to this task force, as well as to provide the full membership. One thing I want to mention is that we have some core principles that we have developed that I would just like to briefly touch on. One is the task force recommendations will be guided by our scientific community and public health experts and informed by and responsive to the needs of people and businesses directly impacted. The second is we'll apply a racial equity lens and culturally responsive frameworks to its work and to meet people where they are and address widening disparities caused by COVID-19. The third is the task force will work cooperatively and closely with state public officials, local health systems, local business and community leadership, Durham's Emergency Operations Center, and our local governments to ensure a well-coordinated response. We heard a little while ago the importance of this well-coordinated response because there are lots of different groups working on various aspects of this. And finally, the task force will move with a sense of urgency demanded by this moment. It will be action-oriented and it will be willing where necessary to take bold steps to place Durham on a path to recovery and renewal. The members of the task force, it's being chaired by Katie Galbraith, president of Duke Regional Hospital, and Matisha Sims. Matisha is vice president and corporate controller of Blue Cross and Blue Shield of North Carolina. The other members will be Ibuku Nakinboyo, assistant professor in the Division of Pediatric Infectious Diseases at Duke Health. Susan Amy, CEO of Discover Durham. Ed Boyd, chief strategy officer for Invictus. Dr. Herbert Reynolds Davis, the senior pastor at Nehemiah Church. Lois DeLoach, philanthropy director at the Center for Responsible Lending. Jeff Durham of the Durham Chamber of Commerce. George Habel, vice president, Capital Broadcasting Company. Philip Harewood, CEO of Lincoln Community Health Center. Rodney Jenkins, health director, Durham County Department of Public Health. Jodi Miller, deputy county manager. Pilar Rocha Goldberg, president and CEO of El Centro Hispano. Anthony Nelson, the dean of North Carolina Central University. And Nicole Thompson, CEO of Downtown Durham Incorporated. I've sent all those names to our council, my council colleagues, and I expect the county commissioners have received them as well. Everyone we asked agreed to serve, which is great. We have, I think, a wonderful group. And now I'll just ask Commissioner Jacobs if she has any additional comments, and then we'll have questions beginning with our members of our school board. Commissioner Jacobs.
Oh, sorry, I could not unmute myself. Thank you, Steve. And I just want to add that I'm just super excited about the task force and everybody who is serving on it. Everybody enthusiastically agreed, and people are just really passionate about coming together to help our community through the next steps. And I just want to add that these leaders will also be forming roundtables. So there will be numbers of roundtables to address all the different sectors in our community, like childcare, summer camps, gyms, and sports venues, salons. So we've got nail salons, barbershops, our religious groups, our entertainment venues, tourism, workplaces, retail, restaurants and bars. And at the roundtable level, we're really hoping to get widespread community input from people who are, have businesses, because as we heard from our report earlier from Rod, we have to be able to continue to keep people safe, and how we operate with health and safety as our priority, and focusing again on testing, trends, tracing is still going to be really vital. And then thinking about equity, what is it that our different entities are going to need? We know there's going to be a resource issue. And so again, as a community, how do we make sure that all of our childcare centers or restaurants have what they need to safely operate, whether it's plexiglass or masks or gloves or sanitizer? Those are just, that's when we get down to the nuts and bolts of it. And we have to think about how collectively we can resource all of these things, and be able to, again, we want to make sure our businesses can survive, but we also have to do it in a safe manner for everyone. So I just wanted to add about the roundtable part. And again, as Steve said, the focus will be on action and moving quickly, not on bureaucracy and big reports and things like that. So anyway, I'm very excited about the next steps.
Thank you so much. Let me just add one thing, and that I should have added earlier. The Ryan Smith has been assigned to support this work, and has already done a tremendous job helping to structure working with our chairs to structure the next meeting of the first meeting of the task force. And I just want to really say how much I appreciate that, Ryan. And Brian Fox of the Chamber will be supporting the roundtable aspect of this. Brian will be working with our various business roundtables. And Amber Wade, my intrepid assistant, is also going to be supporting this. And so we're very excited about that. There will be several partners as well. There will be a language access partner. There'll be a racial equity partner. And this work is, Ryan and the chairs are giving thought to this already at this point. The Center for Advanced Hindsight is going to offer its services for free. One of the things we know is that we're asking for a lot of behavioral change from people. And that's what the center does. And they're offering their services for free. So there's already a lot of work that's been going on, and I want to appreciate that. And now I want to open this up for questions, and I'm going to begin with our school board members. We'll have just a few minutes for questions. I see Natalie Byer. Welcome, and welcome your question.
Thank you for sharing this really important work, Steve and Wendy, and for gathering these great community leaders together. I continue to be concerned that the national model and the national messaging is letting people feel safe when it's not safe to reopen. And I know this group is going to be using data and modeling to continue to watch what's going on in our local community. But I think it's going to be really important to find what strategies to communicate that risk that is ongoing in all languages to everyone within the Durham community, and especially teens and young people, because there's such pent up interest in getting back to a normal life. And I trust that you guys will have great minds thinking that through, but sharing that data about how we're not ready. we need to do this so cautiously in all these settings. So I appreciate all the communication help that's going to be so essential as we communicate this to the Durham community.
Thank you, and I'm glad you brought that up. One of the reasons that we have Dr. Akinboyo from Duke, who is one of their leading epidemiologists and is amazing on the task force to help us think that through, because you're right, it's so critically important. We have to be very, very careful and I agree with you about the messaging. We've asked Discover Durham if they would help us with the communication strategies. They do such a great job with that, and they've agreed to help lead that, and others will be necessary as well. But you're so right. Other school board members with questions or comments at this point?
Hi, this is Bettina. I do have a question. First, thank y'all so much for this work. It's been really exciting to see that we're thinking about today and the future. As businesses are considering reopening, we know that schools and children and childcare all are interconnected. Will that task force also be communicating with the school system? Because I think we will also need support as we consider what does it mean to reopen schools and what that looks like for educating children.
Yes, great question and very super important. So the test, one of the things we have been thinking a lot about is the fact that the school system and our universities have their own big planning processes underway already, as opposed to some of our other less organized entities. So for example, restaurants, our places of worship. I think in the more urgent sense, they need more support right now. So we are already, I think, beginning today. There's a group of clergy that'll be meeting to start talking about how places of worship can safely begin to think about reopening, beginning with meeting outside, those kinds of things. But as we move away from this most urgent work, we definitely want the task force to be carefully coordinating and supporting in any ways they can the school system and the universities as needed. And so that coordination is going to be really, really crucial. And we love any guidance that the school system has to offer in ways that that communication could work the best. So let's stay in touch, and please let us know and let the task force know, especially through Ryan and Amber, any ideas that you think we ought to be pursuing and any kind of coordination we ought to particularly be pursuing.
Thank you.
Thank you. Other school board members?
Yes, Steve, this is Minnie. I'm
Minnie?
really excited about the task force and the people that you have on it. When you talk about communication, we want to communicate in the language that we know our children understand, and we want to use the venues and the equipment or the sources in which they use. So we're talking about Instagram, your messages that go on Instagram, messages that go on the radio, messages that they receive. They don't do Facebook, but what our kids listen to. We can use maybe some of the DJs or some of the people that are most responsive, Joshua Gunn. Somehow it has to be a message that resonates with them, that this congregating in large groups is not going to be great. They may not get infected, but they will bring whatever back to their homes, and that's what will happen. So somehow we've got to get that message to our young people. As the malls open up, they're going to congregate, and we understand that. So I'm glad we're looking at how we will communicate and what's going to be most effective to get it over to them. Thank you for that.
That's a great comment, and duly noted. I haven't thought much about that, and I don't think many of us have yet. And so I really appreciate that comment. We need to do that for sure. All right, I think we have time for one more question. Any more school board members have a question or comment? Any school board members? If not, we'll move to county commissioners. Any county commissioners have a comment or question? All right, city council members, time for one more question. Councilmember Freeman.
Thank you. I appreciate the comments that were made. They highlight some of the questions I had. I appreciate that all of this has been put together in probably a matter of days, and how many folks have been willing to sign on to support. I wanted to make sure that if there's a task force that's going to be raised to address the community side of this, then I'll leave it to that. But this is specific to more like business, and so this task force is geared more towards business. And I just wanted to make sure that if there is a task force that's going to be geared more towards the community, then that is actually done, as opposed to trying to squeeze that into this business focus.
Thank you. Duly noted. Thank you. All right. We're going to move on from this item.
Could I raise one thing?
Sure.
You know, it still hurts my heart, the number of deaths we've had in our long-term care facilities. And if we have another surge, I just hope and pray that we are better prepared to protect our seniors. So I would like to ask that the task force look at best practices on what we could do in long-term care facilities to better protect the health of our seniors.
I appreciate that very much. And that's something we've talked about. Haven't gotten to thinking hard about how to do that yet, but I think that's absolutely critically important. So thank you. We will make sure that happens. Thank you, everybody, for those questions. I'm sorry we don't have more time for each of these items.
Mayor Schewel, I'm sorry. Charlie Reese had a question in the chat, and I don't know if you saw it. He said, "Can some?"
Yeah, I did, and I was going to answer that. Thank you so much. And Charlie's question is, can someone ask what's going to happen with Durham stay-at-home order on Friday? The single most frequent question I hear from folks in the community. Thank you for that question, and thank you, Natalie, for raising it. We will be extending Durham's stay-at-home order, and we will be announcing that sometime midweek. It's almost midweek now. We will be, I think I can say with safety, that we will be simplifying our order. We will be adopting the governor's order, and we will be adding our own restrictions that we think are important. For example, we will keep in place the requirement for face coverings when people are not socially distancing, which is not in the governor's order. And there will be, we will have other similar requirements that are beyond the governor's order. It's important to note that the governor's order preempts us in the area of retail. We're not able to reduce make any restrictions more stringent than what the governor has provided for retail businesses. But in other areas, we have been encouraged by the governor and by the State Department of Health and so forth to have our own order that is more appropriate for an urban area, and we'll continue to do so. Okay, more details to come on that in the next day or two. And now we'll move on to item 7, report on eviction diversion program, projected needs once eviction moratorium ends. And I believe we're going to hear from Janine Gordon, Reginald Johnson, and Karen Lado. And so I want to welcome each of them. This item, so I'll welcome each of them. And who's starting us off? Janine, are you up first? Can't hear you, Janine. I think you're muted. Can somebody unmute Janine? Or I think she may have unmuted herself, but still is not able to be heard. Hey, Janine.
Hi, Mayor Schewel. Can you hear me now?
Yes, ma'am. Welcome.
Great. I'm
Janine,
happy to go first.
Before you get started, I just want to express our appreciation to you and this team. This eviction diversion work is something that the city and the county, I'm really proud to say that we've been working on it. We've really gotten a good foundation going, both from the legal side and from the rental assistance side. And I really appreciate the cooperation that you all have shown over these last couple of years to make this work. And now we really need you more than ever. So thank you so much. And I'm sorry, Janine, go ahead.
Well, I appreciate the opportunity to speak about this. As you mentioned, this program has been going on for several years. In the beginning, it was a collaboration between legal aid and the Department of Social Services. In FY19, the county commissioners decided to add funding to the eviction diversion program so that we could assist financially as well as legally for those individuals who had eviction filings. Those fundings amounted to $90,000 in FY19. We ended up assisting 99 residents of Durham County for a sum of $128,937. So clearly the need was there. And obviously that was in a time when the economy was doing better. And in this fiscal year, FY20, we had the ability to reallocate some money and get additional funding from the county commissioners for $180,000. Obviously, we had a malware attack in the beginning of March, so that kind of ended our ability to assist for a period of time. However, by February 28th, we had already spent $136,725 of that $180,000. So looking forward, if we look at the number of filings that have already occurred in March, there have been 913 filings, I believe, in March. And that was at the very beginning of the coronavirus coming into our community. And we look at the number that is moving into April and then now into May, those numbers are increasing as the number of people filing for unemployment is also increasing. So Durham County has allocated an additional funding source for those impacted by COVID. They have generously offered $50,000 for eviction diversion for those who have lost their income due to COVID, as well as $50,000 for emergency assistance for other related costs. That's what we have on our end.
I'm sorry.
I'm
Thank
sorry,
you
I
very
can't
much.
hear you.
Yeah, I'm sorry. Thank you. Thank you very much, Janine. And I believe now we'll hear from Reginald Johnson.
Greetings, Mayor, members of the County Commission and City Council. What we'll do is just, Karen, Lado Assistant Director, has some data on the program that we've been involved in from the standpoint of legal aid and DSS, and she'll provide that information.
Thank you very much.
So yes, so I'm Karen Lado, Assistant Director with the Department of Community Development. And the City of Durham is currently providing funding to Legal Aid of North Carolina to support an eviction diversion program. So the way this works is the city's funding really is going to support the legal assistance portion. The county's funding is really providing the support, for example, to catch up on arrears and otherwise to get, and those two programs work very closely with each other. The city is providing $500,000 for this 12-month period to legal aid. That funding is supporting 6 attorneys, 2 paralegals, and 1 community resource coordinator. The goal is to assist over 800 households over the course of this 12-month period, and to enable 60% of those households to preserve tenancy and 70% to avoid an eviction judgment. The work right now of that team is a bit slow because right now there is a stay on evictions. But I think in the conversations that DSS and Legal Aid and the city have been having, I think we are both very anxious about what is going to happen when that stay is lifted, which is currently, I believe, in June. And because we do know that nationally, somewhere between 1 in 5 and 1 in 3 renters are behind on rent. And we have no reason to think that our market will be any different than what is happening nationally.
Thank you so much. So thank the 3 of you all for that. And I'm going to now open this up for questions. And I'll start with our county commissioners. Any commissioners have any questions or comments at this point for the folks talking about eviction diversion? Questions, comments, Commissioner Jacobs.
Commissioner Jacobs, you're muted.
You're still muted.
Okay. Thank you, everyone. This is a great joint city-county effort. I appreciate all of you, Reginald, Karen, Janine, for all of your work on this. Karen, as you alluded to, we're facing, I fear, a real crisis when June 1st comes around and the stay on evictions is lifted. Do we, between legal aid and you, have you all done any projections really of kind of minimum, maximum, any numbers that we're looking at, and what the projected need might be for legal help as well as help with the rental assistance?
We have not done any projections. I think it's hard based on the data we have for us to think about how to do those projections because it depends on how many of the people who have lost their jobs are able to access unemployment, and then what the reaction of landlords and the ability of landlords is to work out deals in these unprecedented circumstances. And we simply don't have information on that right now. But I think we are, the anxiety we have is it's going to be a very big number and more than our ability to serve.
Yeah. And I know that there is discussion of using $500,000 of some CDBG funding that you all have, and working with creating a program, a rental assistance program with that funding. It's my understanding that that's currently under discussion right now.
Commissioner, this is Reginald Johnson. Yes, that's under discussion. We are also looking at making some recommendations on the comprehensive use of our funding, but that's one of the important priorities that we're evaluating.
Yeah. Well, I would just say that I feel a huge urgency around this. I think between food insecurity and housing, and I think the others for me are also jobs and job retraining, and then digital access. I think that we really are going to need some type of comprehensive strategy related to the eviction diversion and just housing security. How do we keep people in their homes? So I look forward to you all delving into this and coming back to us and making some recommendations about, from a system point of view, where are we going to be most effectively able to use our resources and work with all partners, the court system and landlords and everybody. I think we're good. This is going to be huge. So I'm glad we're talking about it now, but June is only a few weeks away. So.
Thank you. We'll have a report from our community development staff at the council meeting on May the 21st, I believe. Is that correct, Reginald?
Yes, sir, that is correct. We'll be making recommendations at the time.
Yeah. So at that time, yes.
I have just one quick question. In the same vein, I've heard a lot about people having to catch up, pay back rent. Reginald, can you respond to, are people going to have to go back and pay the back rent from the time they haven't paid it? Is that going to be required?
Commissioner, one of the conversations that we're having with legal aid and DSS are the parameters around that. I will share with you that in terms of the funding that we're talking about, one of the specific restrictions is that it be 3 months limitation on the funding that we're considering. And so it's 3 months, whether it's a combination 2 months back and 1 month going forward, or whether it's 1 month going forward or 2 months back. That is built into the funding. And so the question that we'll have to answer and be able to discuss with DSS and legal aid, when persons have more than that, what does that look like? And what are the options around it. So we don't have an answer for that just yet.
That's going to be real key for what the citizens will do when we expect them to pay 2 or 3 months in back rent. That doesn't sound very pretty.
Yes, and I would agree, and that was one of the reasons that legal aid is involved in this as well, as one of the partners.
Thank you.
Thank you, Commissioner Howerton. Are there any other county commissioners that have any comments at this time? Are there any other county commissioners that have any comments at this time? Are there any other school board members that would like to ask questions at this time? Any school board member?
Yeah, this is Xavier Kaysen.
Welcome, Mr. Kaysen, and glad you're with us.
Glad to be here. Karen had mentioned a 12-month period in the effort that she was talking about. I was wondering about the funds that Janine mentioned. Is there a period of time on those funds? Is there a discussion about the extension? Because I think the ramifications of the impact on jobs and home insecurity is just going to be a long-term situation. I'm just wondering about, are those funds being looked at as possibly being extended or recommitted long past the money that's there now?
If I may answer Mr. Kaysen's question, the money that the county commissioners have allocated to this cause, the $50,000 for eviction diversion and $50,000 for emergency assistance, that does run on the fiscal calendar for the county, which means that those dollars need to be spent by June 30th.
All right, thank you very much. Are there other questions by members of the school board? Any other questions by members of the school board? All right, if not, I'll now move to the city council. Are there members of the city council that have questions? If you do speak up, my screen is doing something funny and I can't see you very well. So if you have questions and you're a member of the council, please go ahead and speak up.
This is Councilmember Freeman. I just wanted to touch back on the conversation and recognizing that the eviction diversion, focusing on the food and the housing is a huge piece. If we don't start focusing on the economic side, I think we'll miss our smaller businesses staying and staying online and being able to support keeping people at work. That could also help. And so I just want to make sure that that's not missed in this conversation. A lot of smaller businesses aren't receiving the support that some of the larger businesses and mid-sized businesses might be able to with federal funding. And so I know that this conversation is limited to Reginald's office and around housing, but it'd be nice to make sure that the 90-30 or 30-60-90 day task force also takes into account what it looks like to support some of the small businesses going long-term as, school board member Carson, and I love the X showing on his emblem, but it'll be nice to have a plan or some recommendations around how to support those businesses that would be helpful in keeping our local economy running and keeping people at work that can work.
Thank you very much. Also on May the 21st, the council will be hearing a report from our Office of Economic and Workforce Development, which will be talking about the city's plans for supporting small businesses. And so that, I agree, that's super important. And that's being done, that work's being done in concert with Duke University, with other companies that have donated to Duke's fund to support small businesses. And so on the May 21st day, we should be hearing about that. But agreed, super important. Other council members?
If I could get more information about that before the 21st, that would be helpful.
So I'm sure the city manager is listening in and can talk to you about it.
Thank you.
Thank you very much. Other questions by members of the city council?
Yeah, this is Javier. Good morning, everyone. I just wanted to say, you know, I feel really great about where we are. I know that our food insecurity issue is huge, but the thing that I think is actually really, really pressing is going to be around rent assistance. And so as many funds as we can find to put towards that. I know that within the Latinx and undocumented communities, it's often the largest concern ahead of even food. And knowing that so many folks are not going to access stimulus checks. And so anything that we can do locally is going to be hugely important to that community.
Thank you very much. I should say also that will be a particular focus of the OEWD recommendations is for our on the business side for our historically disadvantaged and immigrant businesses. I think this is just a good time to also mention that the county should be having a very large amount of money that's coming through the CARES Act through the state. That's not come to the city, it's come to the county. And so I know that you all will be figuring out on the county commission side what COVID relief activities you want to support. I think that we all know what those priorities are, and some of them are being illustrated here. But I know that this money is going to be in the millions, and so it'll be great to see how the county is able to allocate that money to support these various priorities. Any more questions by members of City Council or comments? If not, we'll move on.
Just a brief comment to say that I know that I'm not sure, I missed the first, a few minutes in the earlier part, and I don't know if the public comments were addressed, but I do know that that Mr. Jim Savara submitted public comments regarding the tax assistance, and I just wanted to highlight just how important it is to make sure that that's a priority as well, noting that the people who are renting are in properties, or especially in my neighborhood, are in properties that are owned by property owners and in rentals. And so that rental assistance, when you can keep the rents the same rather than raising them in a year like this year, it's helpful as well.
Thank you. Any comments by members of the commission or questions? County commissioners, anything on this topic? All right, thank you. We'll move now to our report from DPS on bridging the digital divide, and I believe that Dr. Hardy is going to be leading us through this. Welcome, Dr. Hardy. And I see Ms. Sidbury, and are you leading us off, Ms. Sidbury?
Mayor Schewel, this is Dr. Mubenga. I'm the one who will start off.
Okay, thank you, Dr. Mubenga. Welcome. We're so glad to have all of our friends from the school system here. You all have just, I mean, the difficult situation that you all have had to deal with. I think we're all extremely appreciative of the work you've done, and just appreciate you trying to meet not just this challenge of the digital divide, but all the work that you're going to have to do to make school happen next year for our kids in the best way possible. And so we want you to know that we support you, and if there are ways in which we can help, and I appreciated Bettina's comment about that earlier. If there are ways that we can help together, please let us know that. So Superintendent Mubenga, welcome, and get us going.
Thank you, Mayor Schewel, for the opportunity. Thank you, and good morning, everyone. So what is a wonderful opportunity for us to be able to talk about digital divide in this platform. I could not have asked for a better venue than this one. So before we get to our PowerPoints, let me just set up the stage of what we are facing moving forward. As you all know, the last time our babies were in our schools was pretty much in March. So we were now really prepared at that time to be able to send our babies home for them to be able to learn remotely. As you're gonna see in our presentation, we have probably one device for 3 students. Moving forward, we got 2 or 3 months. We really wanna make sure that we're gonna have enough devices for our students to be able to take home. We really wanna be one-to-one. It's gonna take a lot of investment from all of us. And also, not only the device, we're going to need a hotspot so that our babies will have connection at home. So that's not only DPS issue, that's something that we all need to be able to be very creative to come up with solutions. So with that being said, we have a task force in place. We're working on reentry, how schools are going to look like next year. Nobody knows at this point. So as you all can imagine, when you have about 40, 50 students on a bus, how are you gonna do social distancing? When you have about 300 to 500 students in a cafeteria, how are you gonna do social distancing? When you have about 1,800 students on any campus, how are you gonna do social distancing? So we're gonna think outside of the box to make sure maybe some rotation, who knows? We're trying to learn more from other places. Even some of the countries in Europe, whatever they're doing, but what we're learning, schools in Europe are really different than the school that we have here. We can learn some of the practices, but it's really different. At the state level, we have a task force that are working on reentry. But states, every district is different. DPS is different. That's the reason why we have our own task force. We have a health department folks that we are collaborating with them. As well, we are consulting with Duke and other places so that we can get the best advice possible as we're moving forward. Our medical experts are telling us that there may be another spike in the fall. That means schools are not gonna look the same. Moving forward, we really wanna be ready. If we're gonna decide there are gonna be some kind of rotations, or our babies, they're gonna be at home at some point, we really wanna make that they are really equipped, they have the devices possible so that they can have good learning. There are 3 pieces that we gotta have in place. We gotta have computers, we gotta have hotspots, we're also gonna have a good learning management platform so that they can learn. Our counterpart at the university level, they did really well. As soon as they were ready to do remote learning, they had all those 3 in place. So we have to make sure that DPS, we're in a better place as we're moving forward. Today, I have with me a couple of my staff members. One of them is Chanel Sidbury, who is Executive Director for CNI. She'll be leading us with the presentation. Then the other person that will also work in that presentation is Tanya Giovanni, who is our Chief of Staff. So I'm gonna let them proceed, and then I'm gonna come back at the end for questions.
Thank you, Superintendent, and welcome to our other presenters. We're glad you're with us.
Good morning. Could we have the presentation up on the screen, please?
I think, Ms. Sidbury, that this just illustrates how hard it's going to be to do digital learning.
Learning as you go, improvise.
Learning as we go.
Learning as we go.
To our tech folks, are we working on getting that presentation up? There we go. Thank you.
Advance the slide, please. Thank you. Good morning, Mayor, Durham County and City officials, DPS Board, and Dr. Mabinga. Chanel Sitberry, Executive Director, K-12 Curriculum and Instruction for Durham Public Schools. It is a pleasure to come before you to give you an update on our one-to-one device planning. Next slide, please. Our collaborative team, including teachers, principals, technology champions, media specialists, and central office personnel, have been working feverishly over the past few weeks. This morning, we're going to share our plan rationale, findings, the device selection and cost, next steps, and then allow space for questions and discussions. Next slide, please. Our country has experienced this pandemic, and we were unprepared as a nation. And we know now more than ever that access to technology and connectivity should be seen as a right, just like food, water, and electricity. Technology truly levels the playing field, and as we increase blended learning opportunities for our students and families, we know it's important for us as a community to also increase access to connectivity and devices for our students. Next slide, please. Our strategic plan goal priority 1, which is increased academic achievement, goal 1B states that by 2023, we want 100% of our teachers, leaders, and staff to use technology as a tool for accelerating and personalizing learning. On this slide, it tells you the specific strategies that we want to enact to get us to that 100%. We know that within this goal, we want to make sure that we use technology procedures, implement an LMS or a learning management system to fidelity, and we want to make sure that we also have appropriate infrastructure to support the additional devices that we will add. Next slide, please. Our work towards one-to-one for Durham Public Schools was already underway, but COVID-19 expedited that with a sense of urgency, as previously noted on our strategic plan goal slide. Our final one-to-one implementation plan will provide specific steps and guidance for implementation on these strategies. At this time, I'm going to turn it over to Mrs. Tanya Giovanni to provide information regarding our current status and our estimated costs for this project.
Thank you, Ms. Sidbury. If you could please unlock my video. And while we're waiting for that, I'll go ahead and wish members of the school board, county commissioners, and the city council good morning, and Dr. Mabinga and Mayor Schewel and Chair Jacobs and Chairman Lee. As Ms. Sidbury indicated, prior to COVID-19, Durham Public Schools was looking into how to increase the technology resources for our nearly 33,000 students. Prior to the COVID-19, we had shared with our board a plan to get us to 3-to-1. We are currently not at that amount as we speak. So in order to determine how to get to 1-to-1, we need to understand where we are. Advance the slide, please. As you can see, currently we have, as of our ADM, at 33,554 students. We currently have 18,554 devices that are in use, which puts us at around, it changes per school, but roughly on average about 3.75 to 1 as we stand today in Durham Public Schools. In order to get to 1-to-1, we would need 19,115 devices. We are currently surveying and gathering data, as you can imagine, on a shortened time scale, and with everyone dealing with all they're dealing with, this is taking some time, but we continue to survey our families and teachers and students in order to have as accurate amount of data as possible for inclusion in our final report and proposed plan to the board. Advance the slide, please. This morning, we're going to share with you 2 options for 1-to-1 for the Durham Public Schools. The first option would be for K-12 1-to-1. As we indicated, the amount of devices that we would need is 19,115. These are preliminary numbers, as I indicated, as we continue to gather data. But using that number and device cost of $360.75 and an estimated hotspot amount of $144, the total amount currently for a K-12 one-to-one deployment in Durham Public Schools would be $9.63 million. And this does not include any monthly costs for hotspots or any sustainability. We plan to address that in our final proposed plan to the district. Nor does it include any devices that may be going end of life next year or in the next 2 years. We included those in viable devices to be completely transparent with everyone. The amount of the device cost on here is $6.89 million, and the hotspots, we are using the 19,000 count, but that would obviously be adjusted as we continue to gather data, as some families may need only one, even though they have 4 or 5 children in Durham Public Schools. The next option would be a 312 procurement, which would not provide for devices for our K1 and 2 students. The amount of devices needed for the 312 procurement option would be approximately 13,336 devices. At the same device count and the same device cost per device and the hotspot cost, the estimated total for a 312 procurement deployment would be $6.73 million, divided out as $4.81 million for the devices. And again, the same story holds true for the hotspots. That is an approximation, but that cost would be 1.92 million devices. At this time, I will turn it back over to Ms. Sidbury.
Thank you, Ms. Giovanni. Advance the slide, please. This is our tentative proposed timeline, knowing that we will have to make continued adjustments as we are preparing and responding to COVID-19 through this pandemic. The first one looking at initial strategic planning. Moving a school district to one-to-one is more than about device acquisition. And in the last few weeks, we've established and convened a one-to-one committee and a subcommittee to consider the strategies and implications for this work. Our carefully crafted plan has to consider what we do before devices arrive, such as funding plan, device selection, policy considerations, proactive professional learning supports, and infrastructure upgrades. It also has to consider what happens once the devices arrive, such as how to inventory them, additional personnel and personnel support, as well as considerations for after the devices are in place in Durham, which is how we evaluate and monitor it for sustainability. While simultaneously doing that work, we are also looking at policy development. We want to make sure that we are looking at appropriate use, technology use, student data protection policies, etc. We'll bring forth those recommendations for policies, guidances, and procedures in July. The next one is looking at device procurement. A device procurement process is a little bit easier. Our information technology department has been working behind the scenes already and looking within our statewide contract 204A vendors to research which of these vendors have the best offerings and price per device, deployment options, and service support accompanied with that. Our DPS finance department, led by Mr. Paul LeSueur, has advised us that we may forego the RFP process and place an order as soon as we are able to do so, because we are using state vendors who are already approved on that 204A list. We look to have devices procured no later than July of this summer. The next box is looking at professional development. We have to be ever so careful as to not present these new devices as the solution to all. Our students will still rely on our teachers' instructional excellence and their ability to differentiate to meet their learning needs. So our summer professional learning supports will be for teachers, leaders, and staff as we shift our paradigm to blended learning. We know engagement looks different online. We know that support looks different online, and our professional learning will focus on instructional excellence in the digital sense, focus on digital teaching and learning competencies, and high impact teaching strategies. Students and parents will also be supported in the future to use technology best as a learning tool. Our next two boxes are device resources or deployment resources and device preparation. We want to make sure that resources are developed and distributed to our staff to make sure that they are able to handle the inventory, prepare for student use, make sure we have a standardized process for adding all necessary software to these devices so that they are ready to go. And then the last box, looking at device deployment. We know that even if we magically have these 19,000 devices, that it will be unwise of us to deploy them all at once. So thinking about a strategic way to deploy these devices all while being prepared in the event that we have another outage in the surge of sickness during our influenza season. Next slide, please. And looking at that proposed timeline, we have some immediate next steps. So immediately we want to bring forth a recommendation to our board for purchase. We want to go ahead and purchase devices and hotspots so that in the event that we have another outage, that we will be able to immediately support our families with both device access and connectivity. We want to focus our professional learning before school closes, as well as over the summer, provide ample opportunities for our staff to get acclimated to our new normal and make sure that we are grounded in research and best practices in terms of digital teaching and learning. The immediate next step is to look at our policies and procedures and make sure that we are prepared for when these devices arrive. The next one is looking at developing student handbooks for students, staff, and families, so that as we are preparing these devices to go into our stakeholders' hands, our stakeholders are also prepared to engage effectively with the tools that we equip them with for learning. And then lastly is our learning management system. Although we do need a standardized learning management system, we know that in response to COVID-19 and school outages have propelled teachers in opportunities where they're engaging in learning management systems and communicating with students based on what they saw best at that time. We don't want to strip away the energy and investment of time that teachers and our families have already engaged in using certain tools. We want to make sure that we allow fact-finding time and get ample input from our educators, our most valuable stakeholders, to give our staff and our administration guidance on what a learning management system should look like. We're prepared to have multiple learning management systems in play based on the individual grade band needs. Next slide, please. Again, thank you so much for this opportunity to give you an update on where we are with our one-to-one device planning. Our goal is to bring forth a final plan to our board in June of this summer. I'll turn it back over to Dr. Mabenga.
Mayor, before we take any questions from the group, let me just highlight a few things about funding. I think we have a wonderful plan in place. As you can see, I was expecting some questions about funding. Do we have funding for all this? I'll say no at this point. We're still working with our board, and we're expecting whatever is going to come down from CARES of funding from federal government to see how we'll be able to meet the needs of one-to-one. But I think we're still in search of funding, how to make this possible. Let me also throw some kudos out there for DPS Education Foundation. They've been closely working with us. As a matter of fact, next week, they're going to launch another campaign for $1.5 million so that they will be able to help DPS to be able to acquire these equipments. So funding is still an issue, and we're still working on different venues how to make it happen. I'm ready for your questions.
Thank you, Mr. Superintendent. Ms. Giovanni and Ms. Sidbury, thank you for that excellent report. Very informative and thorough. What a mammoth task, but you all seem like you're up to it. And I just want to appreciate you all for putting together what is a very, very comprehensive plan. And Mr. Superintendent, thank you for your leadership. And I'll now open up questions. I believe that the first questions this time go to members of the City Council. Hope I've got that right. For council members, do you have any questions for Ms. Sidbury or Ms. Giovanni? I see a question from Councilmember Middleton. Councilmember Middleton, do you want to ask your question? I see you have it in the chat, but you may want to go ahead and ask it of the group.
Thank you so much, Mr. Mayor. Can you folks hear me?
Yes, we can.
Very quickly, very directly, are there any legal barriers that preclude the council or the city from partnering financially with the county in the case of financial shortfall?
Are you talking about particularly in the area of the digital divide?
Yes, sir. Procurement of the devices, stuff like that.
So I'm not sure if our city attorney is on. She might be. And if she is, maybe she can help us with that question.
I'm sorry, Mr. Mayor, I'm here. Can you repeat the question, please?
Sure. Good morning, Kim. Thanks. Sure. Thank you, Mr. Mayor. I was asking if are there any legal barriers that would preclude the city from partnering with the county financially in procuring the devices for our students for take home for distance learning?
I would have to research that, Councilman Middleton. I would assume the city and the county can do an interlocal agreement for such procurement. We do partner on all kinds of collaborative things. So I think that can be done, but specifically I've not considered that question. I would like an opportunity to look at it. But given the city and county's collaboration on a regular basis, I think that would be feasible.
Absolutely. Thank you so much. I appreciate it. I'd be interested in what you find in researching that.
Okay, of course.
Thank you.
Thank you, Mr. Mayor.
Thank you, council member. Other council members at this point? Other city council members have any questions for our school folks? All right, we'll move to county commissioners. County commissioners, Commissioner Reckow.
I want to thank the schools for this presentation. I've been so concerned about learning loss during the past few months, and now we're going into the summer. So this plan is so important, and I certainly hope we can find the funding to move it forward. In that regard, what, Dr. Mobenga, do you estimate to be the amount of funding you will receive from the CARES Act?
We don't have the figure yet. All is going to be based on Title I schools. That's how DPR, they're going to be able to allocate the funding. So it's going to be a formula based on Title I schools.
So you don't have any, I had gotten, in fact, I forwarded it to you, an early, I think this was just based on enrollment that was about $3.5 million, an early estimate, but that I think there were opportunities to get more. Maybe that's what you're referring to related to Title I.
I think at least I'll feel comfortable. We may be able to get a good $5 million out of that particular program.
Okay, so approximately 5. Well, that's a possible down payment for what you're trying to do.
That's correct.
That's a good start. And I'm glad that,
yes.
And, you know, from what I've read about communities around the country, clearly the public-private partnership approach and trying to get the business community engaged is a good idea. And so I'm glad to hear that you're already on that. And I certainly hope our business leadership will step up because this is just so important. And I'll just say, and perhaps we can have a more protracted discussion on this next Tuesday.
Thank you.
Thank you.
Thank you, Commissioner. Other questions from our county commissioners? Commissioner Jacobs.
Thank you, Mr. Mayor. So I'm really glad we're talking about this. I actually requested this be on our agenda today because I think this is really, really urgent. For me, it's really not just about making sure that we have equitable digital access is fundamental, not just for our K through 12, but also for our workforce. As we're looking at people working at home as much as possible, which I think will be for the foreseeable future, this is a really important equity issue, and also for our higher ed. So I hope that we will also take a holistic approach with the city and the county. I think we need a Durham County strategy around this, because again, this is connected to jobs, education, and even thinking about retraining when we're thinking about our people who are unemployed now, and some of the options for certification programs online and job retraining. I hope actually one thing that I will be asking our board about is us doing a, which Greg Mara, our IT director, has talked about what some of the other counties are doing about broadband access for some of the underserved parts of our county. There's a lot happening in the state right now around broadband access, and that's one of the next steps that we can take, because we do have parts of the county that do not have access to broadband. Sorry about my dog barking. I also want to just throw out there about the library being a part of the solution here. You know, our wonderful main library that hasn't opened yet is going to have a lot of digital resources. I don't know what resources the city has, but I hope that we'll have a comprehensive strategy with DPS, the city, and the county around digital access. And what Commissioner Reckow just said related to public-private partnerships, I hope that there is interest in, I think there is, I know there is, with Duke University partners and also the private sector in this. So I hope that everybody will be coming together around this initiative. And thank you, Chanel and Tanya, for your great work on this fantastic plan that you have laid out for us. So thank you.
Thank you. Any other questions by commissioners?
Mr.
Howerton?
Mr. Howerton, not really a question, more so that, you know, this is a conversation that has been ongoing for quite some time all across the state. As a matter of fact, I have a conversation at 2 o'clock with the association about all of these issues, especially in the rural counties, you know, and people think that Durham doesn't have those issues, and we do have those issues. So my questions, I think I'm going to hold my questions until we meet with the school board, and hopefully by that time we'll know exactly what the dollars are that we're getting from the CARES Act, so that we can talk from the budget and what kind of dollars we have. But thank you so much for the report.
Thank you, Commissioner. Any other county commissioners? If not, we'll move to our school board members. School board members, any questions or comments on this report? Natalie.
Thank you so much. One of the reasons we wanted to share this with you is to have deep conversations, and we can continue those in the coming weeks, but particularly on the issue of digital connectivity and whose responsibility and where that lives going forward for funding, I think is going to be so critical. I hope that there's ways that we can look beyond the school system for that connectivity in the long term, because it is such an equity issue within the community. So we appreciate y'all's support in that.
Thank you. Unfortunately, our ability to influence our private telecoms to provide access everywhere has been very limited, but it's super important. So thank you.
Hey, Mayor, it's Mike. I can't turn on my video, but I want.
Shirley, go ahead.
All right. First, I just want to thank the DPS administration and staff for putting this together. This was extremely important. This is an issue that we've been talking about for a very long time for situations like this, and possibly for situations in case of, you know, snow days or extended weather breaks, you know, if needed. But I did want to make a point. I don't really have a question. I did want to make a point, and I want everyone who may be listening to understand that we're not trying to replace our in-school instruction, right? We are not trying to, we all believe that, you know, having a teacher in front of a classroom and and students and seats is the best way for education to happen. And we truly believe that. And I also want to mention that, technology, it does help to balance things out, but great teachers, great staff, great school buildings are the things that actually are the factors that, that make education great itself. Technology is a supplement. Anything that we do in technology is a supplement to what we do for for what we do with our students, with our teachers. It's a supplement, and that supplement sometimes can, level the playing field as it relates to, access and educational type opportunities. So I just wanted to put that out there. There's a lot of people who are concerned about, what this might mean. Obviously our security and everyone is reviewing what privacy looks like, what personal information looks like, all of those sorts of things. But what we're trying to do here is to help to level the playing field. We will continue to grow our excellent teaching staff. We will continue to grow our curriculum. We're growing by leaps and bounds in those areas. But technology, I just want to remind everybody, is a supplement and does help to bridge the gap in a lot of respects. So I do appreciate this. This is something I've been pushing for since I've been on the school board, and I'm really excited to see this come to fruition. So thank you all very much. I really appreciate this.
Thank you very much. Thanks for the comments. Any other school board members?
Hi team. This is Minnie. I'm really happy that Mike said that technology is a supplement, but this is the new normal, guys. And we may have to get adjusted to the fact that we will be using technology as a tool to deliver information and instruction to our children. As Wendy said, we'll be educating sometimes those who are the undereducated. We will be doing continuing education. We'll be doing higher education. We'll be doing a lot of things via technology. So providing one device in the home will certainly help where there are none. And it is costly, and the CARES Act is going to provide some funding for us. But we're going to be looking to our county and our city and our partners as well to help provide and level the playing field for clearly those who need it the most. One computer in the house, one device in the house, in a family of 5 where you've got 4 kids in school, is going to be a challenge as well. So we all know that, but I want to thank you for the discussion. I want to thank Durham Public Schools for tackling this. We're trying to figure out a way to do this when other counties have had this for a long time. I mean, smaller counties have tackled this and done it 1-to-1, Moore County, just smaller places. So I'm glad we are Wilson County. So we are the intelligence community, and we expect Durham to step up for its children. So that's our task at hand, and hopefully we will get that done. Lenovo has given us a price, and all of those things are going to be discussed with you. So it's going to be costly, and we have to buckle down and just do exactly what it is we have to do so our children have the access to a quality educational experience while we're going through this pandemic. Thank you.
Thank you. And thank you for Wendy for getting this on the agenda today. I think it was a really important report. Mr. Superintendent, Ms. Giovanni, Ms. Sidbury, thank you. We appreciate you, and we look forward to continuing to work together going forward. Thank you so much.
Thank you, Mayor.
We've now reached the end of our planned agenda, but we have another item. And also, I believe, Commissioner Reckow, I understand that you had some corrections to the minutes. Do you want to tell us about them now?
Thank you, Mr. Mayor. In the March 10th minutes, I had 2 minor corrections. On page 2, second paragraph, 3rd line, The wording says Eastern Childhood Initiative, and it should be East Durham Children's Initiative. And then on page 7, 6th paragraph, we need to insert in front of merger the word city-county. And I believe that's in the 2nd line.
Thank you, Commissioner. So with those corrections and the one I made earlier, I believe they're all minor enough so that our previous approval of the minutes will stand. So with those corrections, thank you. And also then I understand that we have another item, and I'll ask you, Commissioner Reckel, to lead us off on that discussion.
Okay. Is Commissioner Howerton still on? I don't know. Basically,
I'm here. Somebody just muted my video. I don't know why. They stopped the video.
All right. Well, I'll kick it off quickly and then you can chime in. Commissioner Howerton, probably 3 weeks ago, brought forward a concept of trying to get masks for our underserved population. And about 10 days ago, I was asked by the chair to joint venture with Brenda. So we've been working together. Essentially, there's a group at Duke, 2 doctors, and Isaac Henryan, community volunteer. They've been working on a project called Cover Durham to supply masks much more generally to our community. And we started working with them. Isaac has done some research on masks that would be able to be had quickly at a relatively low cost. He delivered samples to Brenda and me yesterday. We looked at them. He also got quotes for an order of at least 25,000 masks. We had actually been in the ballpark looking at about 15,000 as a first effort, but if we want to get the lower cost, we need to go higher. The favored mask is one that Winston-Salem is using for its universal mask effort. And the company that makes those masks is Renfro out of Mount Airy. They could have the masks to us within about a week. The mask cost at $25,000 is $2.95 each. If we were with our original plan of about 15,000 masks at that price, it comes out at around $44,000. And then we did want to get a distribution system that would really focus on the underserved population. And so we reached out to the Community Health Coalition chaired by Dr. Elaine Hart Brothers. And they have put forward a written proposal to us that would amount to about $5,900. And it would employ part-time 12 community outreach workers who they have used for other initiatives over the past few years. They are trained, and they would be out going to the public housing communities, senior center, senior housing, grocery stores in our low-income areas and other places that people go, etc. Not only distributing the masks, but helping to educate our citizens about how to wear them and the importance of using them. They actually have a flyer developed already, but it would be amended a little bit for this effort. They were out I think it was last week or the week before at McDougall Terrace with this initiative using some masks made by volunteers. So they've already done this work. So we have a good distribution situation. So basically, to cover 15,000 and the outreach would be about $50,000. And we were hoping, the commissioners are looking at our unspent travel money. We're also looking at unspent funds that we have in our budget related to meeting refreshments, since we're not meeting in person for 3.5 months this spring. Also, money for attending events, which is down. Any unspent money of that nature. And we were actually thinking if the council could do similarly and the school board, what would be nice is to fund this jointly so that this Cover Durham initiative would be an initiative of all 3 governing bodies locally. So that's the ask. So what I'm thinking of is 20,000 from the county, if possible, 20,000 from the city, and perhaps 10,000 from the schools.
Thank you very much.
So,
Mr. Martin, do you have anything to add?
Just a little bit. I think Commissioner Rakow covered it extensively. You know, this started out of a citizen calling, being upset about people on the buses, getting on the bus without masks. So once I heard that, I called the county manager and talked to Wendy about what the citizen had called about. And I think the manager either talked with the mayor or the city manager about it, because she's called me back again. She's still upset that people are getting on the buses without masks. So I think it's grown a bit extensively more than what it started out to be, which is great, because I'm still seeing people at places that are not wearing masks in the community. And people are concerned. So if we're talking about, I think you're talking about $40,000.
Well, goal would be 50,000.
50,000.
Mm-hmm. That's what we need.
Yeah. So we've got the samples of the masks. If the city would like to see those, we can leave those at the county office and have someone deliver them over to the city. But if we are lifting the stay-at-home order, I think it's very imperative that we go ahead and get something done so that makes sure that people are taken care of as much as possible.
Commissioner Howerton and Commissioner Rakow, this is Mike. From the school board, as far as our school board fund, and from some of the unused travel that we were not able to do with like the National School Board Association, I could commit to about $10,000 of that to this fund. So I can commit about 10,000.
Super.
I think thank you, Mike. I think that I don't ever use any of my travel money, or hardly ever, and I have a whole ton of it, and I'm happy to do that as well. I think it's a great initiative. This is this group of doctors and the folks that are working with them have done an amazing job, and I'm glad that you all have hooked up with them for this. So thank you. I'm sure that my other colleagues will be happy to support as well. I see a thumb up from our Mayor Pro Tem.
This is great, guys. Glad you all are doing it. Are the masks, are these masks going to be reusable?
So here's what the mask looks like. Am I unmuted? Can you hear me?
You're okay. We can hear you.
So this is the mask, and it is washable, it can be washed as many as 25 times.
Great.
And it was designed by a doctor who's at Wake Baptist Hospital in Forsyth County. And this was, Isaac Henryan is working with Dr. Greenblatt and Dr. Westman. And they looked at these masks and the other samples that we got, and they decided this one was probably the best. So that's why we're thinking of this one. Now, let me put in a plug also for the fact that we still need to find, to get to the low cost, the $295, we need businesses or governmental organizations to buy 10,000 more. We're also hoping Duke may join and partner. But I wanted to say, if the city or the school district wants to buy some masks for your employees as they start to onboard and work at the workplace, I was thinking we may also work with our staff to see if they want to buy some. If we could pile on, layer on, and get purchases of 10,000 more of these at a good price, then we will qualify. So that's going to be very important too. And we'd like to make the decision by early next Tuesday, because if we do, then we get these back probably by the beginning of the following week. The turnaround's pretty fast. They can manufacture 1 million of these in a week.
Yeah, my only concern with that, as I expressed last night, this particular one ties in the back of your head. And if they can do it where you can put it over your ear, I think it would be, people will wear it more. But if you've got to tie it in the back of your head, I have some concerns about people being willing to wear it. So we need to talk to him to see if he can do it where the string is behind the ear versus tying it in the back of your head.
Well, you can tie them also sideways behind the ear, so you'd get the same effect as a little elastic, because these are, what's nice is the ties are elasticized, so there's some flexibility to them.
I just know the ladies are not going to put this on and tie it on
exactly.
They're just not going to do it.
Well,
So,
I'm going to ask you all to take this important discussion in that detail and figure it out. But I appreciate the concerns about style and comfort. But I think what would be good is I'll poll our council and see. I'm sure some people have spent some travel money already early in the year, perhaps, but I expect that there's a good deal available. I saw Mark Anthony put a thumb up as well, and so we'll let you all know what we can provide, and it will be a good, solid contribution towards what you're aiming for.
Thank you.
Thank you for doing that. Colleagues, we are here at 12:02. We're 32 minutes over. And so I'm going to thank everyone for a great meeting, especially our presenters, our staff, the tech folks that made this all happen so beautifully, our clerks, and everyone else. And with that, I'm going to say that we are adjourning this meeting at 12:03 p.m. Thank you.
Thank you.
Thank you.